We will have to do all voting by roll call since I'm not all physically present. The agenda is essentially the same, except for, I believe, item 7 is no longer, has been put off, is off the agenda. So we won't talk about that tonight. Just to remind everyone that this meeting is being audio and visually recorded. Are there any public comments for any issue item that is not on the agenda tonight? Anyone in the room?
Sorry, hold on. I think we might have.
Someone is raising their hand and I can't see that far.
Meg Rowley.
Meg Rowley.
Who was there?
Meg Rowley.
Yes,
Can you guys hear me okay?
I can hear you.
Oh, great. I just wanted to bring to the public comments. I sent a letter to the Board of Health this Monday, and I just wanted to make sure the Board of Health got it. It's regarding whether or not there's any plans to do any kind of environmental analysis over at 2, 4, and 6 Fairgrounds Road, where there's a lot of proposed development, particularly with the pending Mass DEP investigation. I think they're going to we're hoping they're going to discover some additional information about the PFAS contamination that occurred in that area. And I'm just asking this question because it is so close to our municipal wells. And, there's even a well offline because it is contaminated. And the most recent test results show well 15 with PFAS 6 of like 55.4 or something like that.
Right.
So I don't know if this is the right committee to bring this to, but I just wanted to put it out there and see if there'd be any kind of hearing.
Yes, I received the letter and I appreciate it. And I will formally get a response back to you.
Great.
I'm just thinking out loud. I'll talk with the health director, maybe best to wait for the state report, but I will formally write back to you sometime before the next meeting.
That's great. Thank you. I just wanted to make sure you got it. And I know I did see a couple other parties as well.
Yeah, no, thank you very much. We'll look into it. And again, it might be best to deal with it after we have some more data, but I have to think about that and discuss it with people first.
Sounds good. Thank you.
All right, so we have the minutes from October 17th. Any comments? Questions? Yes, ma'am.
Yes, making sure, on the back, it said that, they quoted, said that believes that short-term rentals are different than private homes or permitted venues because there is not the same level of property owner oversight to ensure the neighborhood is disturbed. It should say is not disturbed.
Yes, okay.
That's all. That's my only.
Any other comments, Carrie? Do I have a motion to approve the October 17th meetings with the correction as proposed by Ms. Lepre?
So moved. Second.
All in favor? Ann?
Yes.
Meredith?
Yes.
Carrie? Carrie?
No, he's.
Yes, sorry about that.
And Jim Spooker?
Yes.
Okay. We have minutes from October 24th, our special meeting regarding the crossing property. Any additions, corrections, additions? That letter was sent and received by the zoning board. Do I have a motion for approval?
Motion to approve.
Motion by Ms. Lepre. Go ahead. Second.
Second.
Second by Jay. Meredith.
Yeah.
James. Yeah. Ann.
Yes.
Carrie.
Yes.
Chairman votes aye. Both minutes are approved. Okay. Online sharing of private well PFAS results collected as per the Board of Health regulations that require testing for property transfers. We do have regulations that the PFAS must be tested at property transfers, and there's some questions about reporting those results.
Yeah, I'll take that.
Please.
So, just a few comments on this topic. So just as a reminder, the PFAS results that are collected or done as, or on private wells are sent to Mass DEP. That's a requirement if they're elevated. Beyond that, the health department gets them. We get them because it's required in the regulation. We also work individually with property owners if they should have elevated rates. And there's additional steps we can take beyond consultation that the Board of Health could take. And that is things like requiring moving to town water, or even installing a POET system. And so those are additional steps the Board of Health has the option to take. However, that's where the regulation ends. There is no language around sharing of this type of data, particularly online. And so just a note of clarification on that. So these results are paid for by the property owners, and the health department, the town, the Board of Health has no input on the content of these reports. So town does not own them. They are privately owned. And because we do not own those results, how we share them has to be carefully considered. So, think about, as you know, many of you know that I worked at CDC for many years, and we would never consider sharing individual property addresses and homeowner information online in a situation where there was a public health issue or concern. If you can think about things like this would be a typhoid house, or this would be a house with 2 tuberculosis patients in it. This is a house that has lead-based paint. Don't go in there. You don't eat the paint chips. Whatever the case may be, it's not something we would ever consider doing. And the reason we wouldn't do it is because, in addition to it not being CDC property, it potentially represents an unwarranted invasion of privacy, personal privacy, which we are all entitled to. So that is, and there's still privacy laws in place all over the country, and including in Massachusetts, that prevents us from invading personal property, particularly from a town perspective.
It's not like back in the smallpox here, actually, there was a great article in Inky and Mirror from that time about putting red flags on people's houses.
Yeah, they used to do
The
something
Board of
similar,
Health doesn't
yeah.
do that.
They used to do something similar with tuberculosis. So, I understand the desire to share as much information as possible.
Right.
In fact, I'm usually in favor of that type of stuff. I mean, it's literally education is in my job description. So we want to share to educate the public, but we have to balance that with personal privacy. The right of individuals not to have the government invading that privacy. Go ahead.
Well, I mean, I just want to point out, and I have said this publicly before, that my house had PFAS, and it was done by the airport, and it was on a map that's on their website, and you can see the red circle that's right where my house is. And all of the other houses that were green or were yellow or were purple, and where all those I mean, it was to identify those wells, but that information, it doesn't say that it's my house, but it says, and I have town water now, but it does show all from the initial, you can see any of the houses that were on Maddox-Cham Valley Road, which ones were positive and which ones weren't. So I'm not saying that we need to share people's names and addresses because the company used special codes, but you look at the map and it's not hard to figure out what houses they are. So I'm not saying that we need to share all of this. We don't need to put red flags out, but I think it is important for maybe keeping track of where places test positive, because I think that a lot of places are gonna test positive, and I think it's important for us to start thinking about, we already have one town well that's down because of it. So like, I guess, how can we track this and monitor it and make sure that people aren't thinking that, oh, well, my total number was under 20, so I'm okay, because they're not okay. So I guess how do we
Yeah, so
do
a
that
couple-
without hanging a red flag?
Sure, and a couple of things on that. I believe the airport paid for all those results.
Does it mean that they're allowed to identify?
Certainly the fact that it has been done elsewhere doesn't make it right to invade personal privacy. And as far as the tracking, that's Mass DEP's responsibility. That's why those results are shared with them. They're tracking plumes, they're doing these law investigation. Our role, Board of Health's role, is to consult with individual private owners of these wells to help them with the mitigation of any PFAS in their water.
So I guess, do we not, if somebody tests positive, we don't say, gee, your neighbor should be checked? Or like, I guess I feel like us as a community and as the Board of Health, like if a house, I mean, if you take Tom, is it Tom's Way? That like, that like, if those neighbors didn't talk, I mean, that seems like it took a long time to get identified, and I just feel like, what can we do to not necessarily, again, identify people like this, there's something wrong at your house, but sort of help them mitigate and also allow people in the neighborhood to know that there is a risk for that. If they all are on a well, because our wells all go into the aquifer, there's just one.
And I'll just go back to what I said. I mean, jurisdictionally, this is Mass DEP's role. We are, we work with individual, and we certainly encourage property owners to share that information with their neighbors, and I think they often do. And if anybody's concerned about their private drinking water wells, they should have them tested. We certainly encourage that. But our role has to be balanced with personal privacy
And
how we share that data. And putting it online is an additional step beyond talking to a neighbor. Obviously, we go out on investigations for various reasons associated with enforcement, where we will talk to neighbors.
And Mass DEP, when they have a positive results, will investigate that.
That's their role, and they
So
follow.
in a sense,
Yes.
they would talk to neighbors.
Yeah.
Okay,
Yeah.
well, I guess that's
mean,
what
they-
you're asking.
That's
Yeah, I
what-
guess I also would just like to know, like, if a house tests positive, like, we don't necessarily need to do something, but knowing where around the island, I can stop talking. There's lots of hands raised.
That's
And
okay.
let me just finish up then with, I guess, with this last thing. So, and this is more of a statement than it is, an explanation of how this is viewed. But the town, we have spoken to town council about this. And any data that is held by the town is the responsibility of the town. And how they share it is a town decision. So unless I am advised by town council to put this data online or directed by the town manager to do so, I cannot share this information online. And I think that nor will we share it in situations if somebody just emails the health department and says, can we have this information? There is a process in place, a public records request process where people can put that in with the town, and the town will make a decision on the advice of council as to how they will respond to that request. If there's information needs to be redacted, they'll redact it. But really at that point, that is the process to get this information if you want to get it.
Okay.
The thing that I'm comfortable, that at least our health department will work with individual people with high levels. And the state department will investigate it. That's their role. Okay,
That's all I got.
Thank
Unless you have any questions, okay?
I'm gonna check on-
we'll take 2 questions, that's all, because from the public, 2 or 3, that's it. And make them brief and please don't repeat yourself.
Carrie or really?
Well, Carrie, if Carrie's,
Carrie's-
well, Carrie to speak.
Yeah,
I'm sorry, I
So-
missed you, Brent.
and that's okay. I'm public too. So I guess question for Rocky would be if a neighbor, so let's say someone on Arkansas Avenue where I live were to call and say, dude, has anyone tested positive on Arkansas Avenue that you know of? Would we be able to say, yes, someone has, if we know, or are we not allowed to say that the person, that we don't got to give out the addresses, but just say, yes, we have. We are aware of those kind of results.
So that kind of request, Terry, would have to go through town administration via.
Okay. Okay, and yeah, I guess, when I was listening to you, it's like, the whole thing of the public versus private, and we ran into a lot of that with special education and what kind of notifications are sent out in terms of protecting identities and kids, and, I appreciate that. So I guess the other question is, everything goes to Mass DEP, they own the results. With our meeting with them, I'm really not, I didn't get the greatest feeling that we're working with them really well. They're not working with us very well. There was, just in terms of some of the answers that they gave were just kind of push off. And I'm just concerned that if Mass DEP owns it, are they doing all they're supposed to do to help the island and to help us, address what is a growing PFAS problem?
Yeah, so we do speak with the state quite often on this topic and others, Gary. So, I know that you have been in meetings with them as well. We have in addition to those meetings, there have been additional meetings that we have spoken with them about. So we are communicating with them. Really, I think Chuck Larson at the town admin has been working with Greg. I can't say Greg's last name, Kidnan. And so he has been working on this issue as well with Mass DEP. So I can't speak to how involved they are with any specific community, including ours, but it is definitely their responsibility, and we do communicate with them.
Okay, thank you.
Okay, we'll take one or two more comments. Move on. Whoever was first. I think Meg. Hello again.
Hi, everybody. First of all, I want to thank the Board of Health for putting this on the agenda for tonight. I appreciate it because this has been something that we've been talking about since this well regulation went into effect on January 1st, 2024. And there have been mixed messages to the public about how the information was going to be shared. And I do understand what Mr. Miramontes is talking about as far as private information. However, it's my understanding that the Board of Health, not Town Council and not the Health Department, but the Board of Health's responsibility is to protect the health of the residents and the citizens of Nantucket. And I will say, as a resident of Tom's Way, I was completely blindsided when I have two wells on my property, both tested over 20 parts per trillion. And there were wells on our street testing at 900 parts per trillion. And nobody from the town or the Board of Health or the Health Department would even talk with us. And everything gets deflected to Mass DEP. There are certainly going to be other hotspots throughout Nantucket. And I do feel that the Board of Health needs to take some leadership. And when you look back on the video in September 21st of 2023, when you unanimously voted this regulation into action, you were like, we're the first town in the Commonwealth doing this. And how proud are we of this? And with that spirit, I really want to implore you to make this information public, whether it's just a street. I don't think we need people's names. And I do think we need to change the way we're talking about PFAS. People are not testing positive. Their well is testing with PFAS in their private well. And it might be over 20 parts per trillion. It might be over 90 parts per trillion. But I think we really need to change the way we're talking about it, how we educate people about it, and really be able to inform people. Because I will tell you, in all the research I've been doing, there are so many parties on this phone call right now that knew within 1,000 feet of my property there were high levels of PFAS, but no one is required to send a letter. No one is required to put an article in the newspaper or post it. I mean, I saw a posting in today's paper about the new septic or the septic tank regulations in Nantucket. I haven't seen anything posted in the paper about PFAS regulations. So similar to Title V exams, similar to when you pull a well permit, all of that goes into health department files. So I don't see how this is any different. Maybe you have to redact names, but you can have the street address on it. So thank you for listening. And I do hope that you will consider that that I'm imploring you to share this information so that citizens have a way to find out in their neighborhood or on their street what's happening so they can stop drinking the water, 2 years before instead of 3 years later when Mass DEP finally gets there. Residents do not have the luxury of time to sit around and keep waiting and people deflecting of who we need to talk to. So thank you.
Thank you, and thank you for some well stated points.
Can I just make a comment?
Please, and
Malcolm?
anyway.
So I think Rocky can probably speak to this way, way, way better than I can, but I know that with communicable diseases, in certain situations, when someone has tested positive, their contacts are notified. Now, is there a way that we could do something similar without putting this online, without advertising this in the newspaper, without doing anything like this, where if there is a high level of positivity in a well, that the neighbors in that same area could be visited by the health department and told that it has been this problem in the area, and they might want to consider making sure that they are tested and check things out.
Yeah. So in the situation of communicable diseases, we get consent from that individual before we will share their names. I'm speaking from past infectious disease outbreaks.
No, I know you know this
And
really well.
So but we don't always have to. Sometimes we would do investigations around a facility. So whether that be a hospital or a restaurant where we knew space was shared, and then we would identify the people that were in that room, speak to them about being tested because they had an exposure without having to name the name.
Right, exactly. That's what I'm
But in
talking
there,
about.
the areas that we did name names, we got consent from those patients before we did so. And it was usually the closest contacts. As far as what your question is about whether we could do something like that, I think if, I would have to speak to town council, but I think we'd have to get consent to do that from the property owner. But I don't know that for sure. I would have to speak with them first.
Even if you didn't identify where the positive well had been, but
Yeah.
it was in this neighborhood.
Yes, again, potentially, and again, going back to my initial statement, this is a Mass DEP responsibility. They look at plumes. They do the follow-up associated with these positive results. We, as the health department, as an agent for the Board of Health, we work individually with homeowners to help them with their individual problems. And so that is, I think that is the distinction there. We have to, I've been told very clearly by Mass DEP that it's mandatory that this be sent to them. And
But it seems to me is if they get a high result, you send them a high result. Is there a way, can we ensure that they follow up, or? I think Ann's suggestion is.
Yeah, no,
excellent.
I think that's completely legitimate, and I think that would be, we did hire our new environmental contamination administrator, who will be starting in early January, and I think that him building that relationship with Mass DEP to ensure that kind of follow-up is done is a great idea.
Because I think Mass DEP took a couple of years before Tom's Way.
Yeah.
It was, and I feel like this is a public health crisis, and this is emerging, but I mean, we're poisoning our children, and if we're not letting people know that their well could be possibly contaminated, then these kids are being exposed to it at young ages. They're not going to be immune to the vaccines they get, so then we're leading to outbreaks of vaccine preventable diseases we're looking at cancers, we're looking at all of these things that if we just were able to say Mass DEP can do their thing, but let's just let you know that someone in your area, I mean, I know in my experience, when you have someone with a communicable disease, their partner can sometimes go to, or their contact could go to the pharmacy and get the medicine. So I feel like that's the same thing. We're not saying who it is, but we're saying,
Yep.
you live in an area where it has been
Yeah.
found, you may want, you should check your levels, and
Yeah.
no level is safe. So if you don't get 0, come and talk to us and let's talk about what
I am open to that idea and
Yeah.
other ideas. I just need to
Yeah.
right.
ensure that that what I am doing is consistent with law.
Well, I think, I think it's a great that we follow up a sentence once we've made a report, and if you have some issues about, you don't think something's being followed up correctly, just come and see me. And then we can deal with the town bureaucracy.
Yeah.
And make our own follow-up.
Yeah.
In a proper way.
And the same thing goes, to and basically anybody in the community. If you have a concern that you not getting a response from the state health department or Mass DEP on issues like this, then we will follow up.
Yeah, that's your job.
Yeah.
Thank you.
Mhm.
Okay,
Two people with hands up. I don't know if
Megan
you want to-
I just wanted a quick follow-up. Thank you for
Yeah,
that.
really quick.
It is very, very quick. I just want to say the Mass DEP is amazing. We've had a good relationship with them all year. I am so excited they're coming to do this site investigation. It's really not, when I ask them about notifying people with test results, they're like, that's not really our job. That's up to the town. So this is where my frustration and maybe my passion is with this is, and from the beginning, when we started hitting high numbers, is, are you guys communicating? And John Hedden was part of that. And I made sure that all these emails were starting to get CC'd by Mass DEP every time test results came in, or as Michael Maynard at the time. So that's where the Board of Health, I really urge you to take some leadership on how you're communicating with residents about this contamination, about what people can do, and to change the language around it as far as this can be remediated, whether it's a point of entry system or a filtration system, but that people know what to do, where to go. And I came up in the June meeting with my platform of, response, transparency and reporting, education, and then having funds available if people need to tie into town water or need to get a filtration system, because sometimes you can't tie into town water. So
We understand it. And again,
that's all. And also just things like when there was the firefighting foam spill at the fire department, or there were also 2 environmental events over at 2 Fairgrounds Road, Mass DEP investigated those. And even in their paperwork, it says to the town, if you want to send out a letter to abutters to notify them, we have a template. We never got any letter about a firefighting foam spill in December of 2022. So things like that, I just don't understand it.
Thank you.
Oh, I'm
I
done.
appreciate your comments. We have
Yep.
to move on. And I think this is a productive discussion. And if we know of a high level reading, we will work our best to make sure people are informed. I think that's what
Yep.
Rocky is telling us.
Yep.
And
Sure.
one comment, then we're going to move on.
Yeah, I just want to go back to the intent of the regulation. It was for property transfers to make sure that people are, again, knowing that there's safe water on the property.
Right.
That's the intent of it. So-
I mean, this information shared by people buying and selling the
Correct,
house.
and anyone else can come into our office and test their well for PFAS. I certainly hope that people would take every contaminant serious, because there's also nitrates and low pH and things of that nature. High sodium, which could affect people, and the hope is that all of this be taken serious, and there is filtration available for all this. So, again, I encourage people, anyone concerned, that can test the well for PFAS through our office.
You can test it, and we will make sure if we have high levels that it's fouled up appropriately, whatever that can be done.
Aries still has a
Betterment Loan Program for Sewer Connection, 10A Field Avenue.
Yeah, this is your run-of-the-mill, septic to sewer application, but no concerns.
Any comments from the board? Do I have a motion to approve the loan?
I make a motion to approve.
Second,
Second.
all in favor, James,
Yes.
Meredith,
Yes.
Ann,
Yeah,
Carrie,
Yes.
and I vote aye, loan is approved. Okay, Three Pops Lane. This is continued from October meeting. And if you could, someone just review it for me again.
If you like to-
Yeah, do you want me to come up for the microphone or?
Yeah,
That'd
come
be-
come
that'd
up,
be best,
come
yeah.
up here.
For the record, Don Bracken from Bracken Engineering. The owner is also here, Michael Kilabash. I'd like to introduce himself and he's here to answer any questions. I know some things came up at the last meeting, that's why we asked it to be continued. One of the issues was there was some confusion as to whether an existing system was already upgraded on this property. And, we said there wasn't, and I think John confirmed as well, there was no existing system on this property, that was recently upgraded, since the property was purchased. The other, issue that came up was the swimming pool behind the house, the location of it, and any health concerns regarding that. We submitted a revised plan. We ended up going out, adding more information on the resource areas to the plan, for both the R review and the Conservation Commission's review. And the pool has been relocated, away from the water between the main house and the cottage. So, the reason we're here is to ask for variances to the Nantucket regulations for setbacks of property lines, which is 50 feet. And Title V is 10. Everywhere else in the town, it's 10. The other setback distance we're asking for a variance is between the primary soil absorption system and the reserve area. Again, Nantucket has a 15-foot requirement, and there is a 0-foot requirement in Title V or any place else on the island. So the property currently has a 5-bedroom septic approved capacity. And we're proposing to go from 5 bedrooms to 6 bedrooms. The lot area is over the 60,000 square feet required in the Nantucket regulations for 1 bedroom per 10,000 square feet. So we feel that technically we meet all the requirements in Nantucket. If this identical property was someplace else and not in Nantucket, we wouldn't even be here. And so, as in the past, I've always wanted to be able to discuss the reasoning and the scientific basis of those offsets. As I've said in the past, these regulations were written in 1973, over 50 years ago. We know a lot has changed since then. The biggest change, especially in this area, is the fact that we now have town water. I think everybody sort of assumed that the 50-foot setback was there to protect properties and potential well locations and that sort of thing. So, that's no longer an issue. And state law, requires that, the Board of Health, if they have any regulations exceeding minimum requirements, that they have to be able to state the reasons for them and why they're required in a particular location. So still always been searching for that answer. And we feel that in this case, yes, it's new construction. Yes, we're increasing the flow. But we comply with all the nitrogen lowering requirements on the property. The only thing we're asking for are the variances to lot line setbacks, which historically have been given. Matter of fact, there was already a variance given for this property when the existing system was installed for the leaching pit that's currently there.
Thank you.
Okay.
Questions from the board? Go ahead, John, Rocky.
I think Dawn pretty much summed it up. I will reiterate again that the board 30 years ago, 25 years ago, did grant variance for the same exact situation. This is an upgrade, certainly. As they said, Dawn Window and if this system failed right now, they'd be able to replace their 5-bedroom system. And that design would, the design there would be the design coming into our office for the repair, which I would consider to be maximum feasible compliance.
Right.
They are adding a bedroom. They have the required lot area, for 6 bedrooms, so, at the moment, right now, it's a benefit.
Yep. Questions from the board?
I think Carrie.
Yeah.
Go ahead, Carrie.
Yeah, question, when we're measuring square footage, of the property, especially in terms of absorption, do we count the wetlands and all that other land as land which is factored in, that even though it really can't be used for those purposes? Or, I said, are we using the total property, or are we using the usable property that could be used for leaching to determine if it's, compliant or not?
It's the total property, because they still have to, honor those setbacks to the wetlands, so, they do get that area, it's just, they still have to maintain those setbacks.
Right, but it's still, if I have a 6,000 square foot property, but 20,000 of it is in wetlands and, can't be done, I still can use the 60,000 number, even though I functionally only have 40,000 as, okay.
Interesting. Excellent question, Bill. Any other comments from the board?
I'm just curious because when it's sold, they should have replaced it and
Yeah.
didn't. Is that, and that was like 2 years ago? Is that right?
It could have been 2 years.
About 2 years ago.
Yeah.
So so it was sold and assumed, I guess, in the sale that it would be replaced because that is what is required, but then was not done. So that now they can have a pool by the wetlands. Sorry, I guess my question is like, what is when you have to upgrade the system, when you sell a house, buy a house, is there not a timeline? Like, it just feels like it's like, then you can do what we can all
Well,
just do whatever we want.
There is a timeline, and
Okay.
it was a technical failure for the IA requirement. So
Mhm.
the system's functioning, it's working, it's not, backing up. So there was a timeline, what is it, it's supposed to be 1 year or something,
So
John?
it'd be like within 6 months of
Right.
having the town.
We've extended that at
Yeah.
times. We've extended that if necessary, but it's 6 months. And,
Yeah.
and the pool is a conservation commission issue, not ours,
Mhm.
Yeah.
unfortunately or unfortunately.
Mhm.
Okay, any other questions? Do I have a motion?
I just, it just, again, I'm going back to the point just made, that something should have been done. And the reason why I bring it up is that we have 2 other issues where the exact same thing. Something was supposed to happen. Board of Health was not involved. Nothing was done. And it just seems like there's a lot of room for people to do stuff that is supposed to be compliant and not. And, what is I'm not, it's frustrating. Maybe it's more of a statement instead of a question. It just seems that they should have done it. There was obviously, it sounds like there was no paperwork filed to do something in time past. They just didn't do it. And that's frustrating to sit there and have stuff come flying back at us later. And it's like, yeah, we didn't do that a while ago, but now we're here because we want to do something different. And it's just a very frustrating situation to be in at the board when people pretty much walk over regulations. So that's my thing, and I'll stop.
Can we be heard as in a butter at some time?
Sure.
Thank you. I didn't want to interrupt, but I want to speak on behalf of an abutter.
Go right ahead. Just any other questions? Yes, go ahead, sir.
Joseph Gay. I represent John and Sarah Hendrickson. They were present at the October Board of Health meeting.
Yeah.
And they've asked me to represent their interests going forward in this proceeding, as well as the Conservation Commission proceeding. I'd like to say they're the immediate abutter to the west of the applicant. And I do want to say at the outset, by way of full disclosure, I've had several matters with Don Bracken over the years. And I have respect for what he has submitted to the board and is representing to the board. And he did give me the opportunity to speak with him in advance, as well as the architect for the owner. And I appreciated that. But having said that, I just have a few comments regarding this property. And to clarify when this property was conveyed, the applicant's property was conveyed on December 2nd, 2021. So it would be 3 years, 14 days from now, or 10 days from now. At that time, I understand that if there was the technical failure, which has been represented to this board, and it didn't meet the more stringent regulations of the Board of Health, and there was an understanding that it would be upgraded to an IA system in the Nantucket watershed area. And it was not done, and it has been 3 years. For whatever reason, maybe the current owner, who's actually the current owner is a gentleman by the name of Matthew Burke, trustee of a trust from Encino, California. That's the current owner. That's a land court registered property title. That property did not receive the benefit of the upgrade. It has been now 3 years. The applicant is now before this board asking to increase the number of bedrooms, which of course increases the flow as well. So I'd like to speak to just two things briefly: the existing conditions and the proposed conditions. I'd like to piggyback on what Don does with his survey work. As far as the existing conditions, as I say, it's been over 3 years. What they're essentially proposing to do is increase flow, and having failed to upgrade this system to an IA system in the past 3 years. Whether they claim it to be inadvertent oversight or the like, I think this board has regulations to enforce, and one of the regulations they can enforce is a cease and desist on the use and occupancy and habitability of this property. There's been, to me, a disrespect by the applicant to the regulations of these boards by failing to move forward with an IA system. They then turn around and are proposing a new IA system, additional bedroom, and they're asking for this board now to grant variances, which I don't believe that they need the variance that they're requesting. They prefer to locate this new IA system in the leaching fields in an area that would require these variances. And this board, I think, unless it's manifestly unjust or there's a hardship, this board has its regulations to enforce without any variance relief. Underneath the application by Don Bracken, he's asking for the variance setback relief from two property owners at 333 Washington, 333, I should say, Nantucket Road and 4 Washington. He's also asking for a variance from the 12-foot variance, the 15-foot required between the primary septic and the reserve area. I think he would also need a variance with respect to the flow, because he'd be increasing the flow. Maybe I'm wrong on that. He can speak more intelligently to that. But there is a criteria for the variance relief, and he could actually locate or site this new system, albeit it would be north of where he is siting it, and he would represent, I'm sure, to this board closer to Hither Creek, but it would be in the area where the existing system is, I believe. And so for that reason, if he sited it in that area, he would not require the 50-foot, the variance from the 50-foot setback, because this property fronts on Pops Lane, and they'd be able to site it 50 feet, and they'd also be able to site it more than 50 feet from the property owner to their south, being the Morans. So it would make sense to me that although they may argue there's a greater level of environmental protection being further away from Hither Creek, I don't believe that this board should grant variances simply because they want to locate it in an area of the property that would essentially allow them a larger building envelope for the proposed structures that they intend on building on that location. So I would ask this board to consider the enforcement of the regulations relative to the property owner operating for 3 years and not upgrading this system. And maybe by way of a cease and desist. And I'd also ask you to enforce the regulations of not granting variances when in fact a system can be sited on the existing property without the need of those variances.
Go ahead, Don, and then we'll.
Yeah, Joe, I wish we had that conversation when we talked, because that's 100% incorrect, because we cannot locate that system anyplace else, because there's a 300-foot setback from here to the creek that takes up the majority of the lot. So the system, and the existing system is in the same area where we're putting the new system. And if we're talking about manifestly unjust, I think it's manifestly unjust for the board to deny this when there's no scientific reason why we need to meet that setback. And the other thing, and I'm sure Michael wants to talk about it, there was a 6-bedroom septic system design brought to the Conservation Commission, approved there after they bought the property. It just never made it to here for final approval. And my assumption is they've been working on coming up with the best plans for the property. And this certainly isn't the only property in Nantucket under technical failure that has gone that long. And I don't know if any letters have been sent or anything by the board, but if it's okay, I think maybe if you hear from the owner, he could probably explain why it's taken so
Well, I'd
long.
like to hear from the owner.
Yeah.
Yeah, hi, Michael Kisselbach, I'm the owner, Joe, thank you for your words, just to
Why don't you come up
clarify.
here so you don't have to shout so much?
Oh, come up?
Yes, please.
Oh, very good.
That way the microphone will pick you up.
Great, this is the first time in my life that people have asked me to come closer because they couldn't hear me. Is this all right?
Oh, I can hear you fine. I just want to make sure
Sure.
that the
Yeah, so.
television audience can. hear.
Yeah. So I appreciate it. Yeah, I am the owner. My wife Nancy and I are full-time residents of Nantucket. We live here year round as opposed to any of our other neighbors who do not. Our property is 1.58 acres. In other words, like almost 69,000 square feet, almost at the 7-bedroom septic level. 100, like a thousand feet shy of that. We really appreciate everything that you are doing in terms of the review of all of this, and just wanted to know that we live here. We've been coming out here. My wife since the 80s, myself since 95. We have always loved Nantucket. We moved there for the sensibilities of everything that it represents, the simpler times of Nantucket. That is why we specifically have moved there. So to honor that, our proposed home build is not 2 stories, which we could have easily proposed, a much larger house, but rather a ranch, a 1-story home where my family can live year round. That's really all I wanted to say. I know that we're tight on time, but I wanted to know that I'm here in person and field any other questions.
I guess there was a question, why was there this delay?
I don't, like, honestly, I just don't, I don't have an answer to that. I don't know enough about septic. I don't know about this stuff. You guys deal with this every single day. I don't know. I don't have any answer as to, there was no intentional delay as to why we would wait any period of time to replace it. So.
I mean, this is something that comes up when you buy a house, I'm sure most of us have bought houses, that this has to be done and you're aware of all of the things when you buy a house.
When you bought the property, whose responsibility was it to do this? Sell it before you closed, or did you agree to do it after?
No, I believe that we agreed to do it afterwards. I just wasn't familiar with
So
timeline.
there's gotta be a reason why you didn't do it.
There is no reason that,
There's gotta be a reason why you knew you had to do it when you bought the property.
Just let him answer the question.
yeah, I'm just, maybe my wife has an answer to that, but there's no intent, there's no hoodwinking. I mean, I'm just telling you just straight out that There is no reason why, I don't even know why would anyone try to defer that? I don't even know a reason why one would want to do that.
Okay, is there comments from the staff? Because we have really distinct, different opinions here.
I mean, yeah, currently the property is in violation. I
Right,
mean, the process would be to write them a letter and give them 6 months to install the system.
right.
What I can say is, we're here right now with an application, so us writing a letter at this point to me isn't
It's kind
really,
of-
you know,
kind of silly.
start issuing tickets, but in my experiences, you know, we're just trying to gain compliance, and I think the court system's gonna see that the same.
Well, my last question is, if you were to write them a letter to get this, would it be the way it should have been when they made? So if, so they waited and now it's a different, completely different system, am I right? They expanded
It
the
could,
bedrooms?
and I mean, it could be how fast that they acted, you know, at the time they got the letter. You know,
Right.
different projects, I think, probably take different precedent with folks, and things sometimes can get faster. Some properties get faster than, or done faster than others. So,
So the issue is, can the system be put where, replacement system replaced where it's presently located? That's the argument I'm hearing.
It's in the general location. It's only a small leaching pit, so what we're proposing, it takes up a much larger footprint than what's already there, but it is in the same general location as the existing system. And maybe that's why it wasn't flagged either, because it was so far away and it wasn't technically, it was only a technical failure, so.
I'm sorry, can you state your name? I gotta.
Oh, yeah, Michael Kizelbosh. It's Kizilbash. Yeah, no problem.
And Carrie has her hand.
Yes, Carrie.
Yeah, Michael, what is your relationship to the Pops Landing Holding Trust?
It is just a trust that our family has. My wife Nancy and I have. We're just holding the house in
Okay, so you're the trustees and everything.
Yeah.
Okay. Okay, just, it's good again, yeah, just because of the casino and you're here, so I just wanted to kind of get this all put together.
Yeah. We do not live in LA. We go there periodically. We do not live there. We do not have a home. We do not rent there. We are. It is just where our trust is located. We live in Nantucket, Massachusetts. We're Nantucket voters. So on and so forth.
Yeah, thank you.
Yeah, absolutely.
Real quick, so
Please identify yourself.
my name is Andrew Tapley. I live at 333 Nantucket. The comment was made that the abutters don't live here year round. I'm a year round resident. I think that ultimately, obviously, and this isn't a Board of Health issue, there's what they're trying to do is greatly increase the building cover of the property. And therefore, in order to build what they want to build, they need to move the septic and the leach field. And that's what the board needs to consider, that what we're drastically changing, whether you agree or disagree with that, we're drastically changing what's happening at the property. And it's just a question of, are we going to allow them to encroach so that they can build the bigger property?
That's often an issue, but we have to deal with.
Understood.
Yeah, I mean, it's like, whether we like swimming pools or big houses, or it's irrelevant to our decisions. We have to deal with the regulations.
But the violation of the regulations is within our purview, and
That
it's
is
been
unfinished.
3 years.
Yes, and that is still concerns me. We've had three.
May I approach as well?
Yes.
Mark Catone, the architect. The only thing I'll add is that I was retained over 2 years ago now. Design process can take quite a bit of time. I've been working with Nancy and Michael on this for at least 2 years, looking at various diagrams and schemes, which I think we usually work up a footprint in a diagram, and then we turn to Don to help with the layout. So they have been, and Michael said he wasn't sure why. I think from a technical standpoint, I don't think he was aware that there was a clock ticking, but they have been actively looking at the lot and what made the best sense, whether There has been discussions keeping the building there, recycling the building that was there, moving it elsewhere on the lot. So internally, we've had a lot of discussion about how this would be developed. Ultimately, we landed here. And the timing was appropriate, then approached Don. Don then developed this scheme with us in the last 6 months or so. So they have been working on it. They haven't been sitting on their hands. They have been approaching it, and maybe they didn't get it within the 6 month timeline. but I
thank you.
think-
All right, let's get back to. Yes, one more and that's it, then we gotta get to the
My
board.
name's Paula Arsenal. I'm here speaking on behalf of the Nantucket Land and Water Council.
Could you come up?
Yeah, sure.
Cause
We just-
my 78-year
Sorry.
ears
I can get better at
sometimes
shouting
need a
too.
little work.
Yeah, we just would like to speak to support some of the concerns that have been raised about this property. We recognize that the system needs to be upgraded. But we question if it didn't go to a 6-bedroom system, if it was staying at a 5-bedroom system, would these same variances need to be granted? It's our understanding that it's within your purview to deny these variances despite the historical variances that have been granted or variances that were granted in the past. And with respect to Mr. Bracken, it may have been easily approved in another area, but this is a very environmentally sensitive area, and we have strong concerns about increasing any input in this region. Thank you.
Thank you for your comments. All right, now for the board, questions, comments, opinions. What would you like to do, board?
I guess my question is, what are our options here? I mean, I think I don't necessarily think there's just one path that we could take, and I'd like to have Rocky and John outline for us what the, you know, what the possibilities are. I'm not sure it's a black or white, but maybe it is. I just need to have that.
Okay, let's see if
Clarified
it's
for
a
me.
black or white. I mean, it's black or white, we say yes or
Grant it
no.
or
Yeah,
Deny it.
but I'm not sure that I think there might be a middle ground. I'm not sure. I need to have that clarified.
Well, I mean, you can deny the variance, it's a local variance. and it's
Yeah.
not
Right,
meeting the-
right. I get that.
If this was a repair of the 5-bedroom system, to answer that question, we would, the board in the past has granted staff to approve those variances based on repair. So no matter what, pretty much on this property, they would need a variance, for any new construction. They're not gonna meet the 50-foot setback or 15 feet from a reserve.
unless
They
they just
need that.
replaced what is already there.
They can, yeah, they're not gonna meet that, but they would be replacing what's
What's
already there for the property, which is in perpetuity.
So that's sort of
Unless
the
they go
third
forward.
way, in my opinion. That's the third. One is up, one is down, and one is this way, which is replace it, but replace it in the,
In time, essentially.
But that's denying the variance request.
right,
Yeah.
I guess that's true.
It all goes back to.
I guess that's true, but that's, yeah.
All right. Go ahead, Jim, and then we'll ask for a vote.
The other thing is, when they designed the thing, when they finally decided to do it, they went right for the extra bedroom, right?
Oh.
That's the crux of the whole thing. I mean, we could grant a variance, but only grant the variance for the time that they didn't do it with the system that they would have put in at the time that they should have done. But now, they waited so long, now they moved it and they're gonna get another bedroom out of it.
Well, if I could, the system, as even John said, even if they did it without doing any of the other work, it would be the same system in the same location. We're just asking for that same system in the same location to be 1 bedroom larger. And the only other thing I would throw out there is, obviously, we're proposing the 6. If you're entertaining a denial, you know, we could come back with the 5, and I think, as John said, he has the authority to approve the 5 in-house. So I think that would be another option for the board if you felt that way.
So we
That-
could deny it, and then you could come
Then
back
you come back
with 5.
Yeah,
Yeah.
or you could approve it with five, if you feel I think
Right.
that's another option you could take.
We could approve the
But,
whole
you know.
thing and just say that this remains a 5 bedrooms, you can't have the other bedroom.
Yeah, you could approve, in my opinion, you can approve the variances to the setbacks that we're requesting with the stipulation that the plan be revised to a 5 bedroom, if that's the only issue here.
All right, so we have those two options. We can deny the variance. We could approve the variance with the condition that it's a 5 bedroom.
Okay, I'm gonna make a motion that we.
Gary wants to say something.
What, Carrie?
Oh,
Last
Actually,
word.
I want to listen to the discussion first again. Keep going, Jim.
He's about to
Yeah,
make
you're
a
about
motion.
to make a motion, you gotta talk.
Yeah,
Go ahead.
okay.
Go ahead.
Again, I think, that work was started 2 years ago on planning for this tells us that, that there was more knowledge than just like it slipped through, and that is somewhat bothersome. But what John said too is that, the system is being installed is the system you would have been installed back then. So this gets to my other point, which I brought up, I think, every month, which is we keep allowing the increase of capacity by saying, well, there's a better nitrogen system, and therefore we can have more people. And I want to go to something else John said earlier about one of the others, which is nitrogen isn't just the only thing we're putting into the soil with septic systems. I concern about that we keep allowing houses to increase their capacity of the number of people to produce waste, which has to be processed, and that in reality that nitrogen isn't just the only thing that we need to be concerned about. I'm done.
So Carrie, you have a solution for our problems?
Well,
I mean, it's an excellent.
okay, so in some ways, if the discussion right before talked about limiting it to 5 bedrooms, but also I think we'd want to see what the is it going to be 5 bedrooms with the existing plan that's in front of them, or would they want to rework the plan for 5 bedrooms with that limitation? So I think that's an issue that have to if we said variance is 5 bedrooms, what does the plan look like? Does that change the plan in any meaningful way in terms of the rest of it? So I would just like to know, I'm comfortable with the 5 bedroom limitation, but does it change the plan?
A cleaner way might just be to deny the variance. And then the proposal would go back to the health department.
Yeah.
Yeah, and as we said, that if it is with the,
Yeah,
I'm sorry.
we're done with comment now. Okay, so
I make a motion if we give them the variance, but we restrict it to stay with 5 bedrooms.
but the question is, you could make a motion just to deny the variance, and they could bring the plan back to the health department.
Well, when they're.
Because otherwise,
Yeah.
it's kind of loose.
Yeah.
It's
Yeah.
loose that way.
I think so.
I'd love to have John confirm that though, before you make that vote.
He just
I mean,
said it.
Yeah,
That has been
Yeah.
the practice
All
in
right.
the past.
That's been the practice in the past, and there's no reason to change it.
I would make a motion to deny the variance.
Do I hear a second?
My second.
Any further discussion? A motion has been made to deny the variance. Meredith?
Yes.
Carrie?
Yes.
Jim, yes. And
Yes.
chairman votes aye. Variance is denied.
thank you.
Okay.
Thanks.
All right, that was off the agenda. 8 Bank Street. And septic variance request for 8 Bank Street. Yes,
Yeah, I'll be here for a while.
Just
Try to erase that last one, right? We're starting fresh. Anyway, to kind of recap what happened on this one. So we submitted back in June for a variance. for this property to be able to reconstruct the existing house and keep the existing septic system that was there. It's a, very tiny lot, on Bank Street, the intersection of Bank Street and Beach Street. There's a old house that the applicants are trying to improve and put a new foundation on and add about 162 square feet of footprint. So the board granted the variance with the stipulation that we put in an IA tank. And unfortunately, there was a glitch in the Zoom and we couldn't be heard to say anything or ask any questions or discuss it. So that's why I asked John if we could come back and discuss that again. And the reason I think that it should be reconsidered is that, well, number one, we're not in a nitrogen sensitive area. All the properties in this area are served by town water. We have adequate groundwater separation. We're not within 100 feet of any wetland resource area. And the cost of taking out the tank that was there, which was just installed like 4 years or so ago, they've gotten prices for $85,000 because of the site constraints and putting the system in and so forth. We feel that there's, more than adequate protection with the existing system, in that the added cost, and it would be a very large disturbance to the property, to the neighborhood, machinery, construction wise, to swap that tank out. So we're asking you to reconsider the requirement and allow us to keep the system that's currently there. And you may also recall this project also had a long history. At one point, they were proposing a basement, and that didn't go over well, obviously.
Yeah.
And so just to refresh your memory, the type of foundation system that's going to go here, so that there's hopefully no concerns with the integrity of the tank during construction, is helical screws are going to be driven, right? So it's not your typical foundation system, even for a crawl space or even for a slab. And then a new slab is going to be put down. The helical screws that are drilled into the ground are going to support the slab to be able to support the structure.
Can I ask a question?
Comments from staff and then board?
Oh, go ahead.
And you're gonna put an addition on.
Yes.
I mean, as Dawn said, that it's not in a nitrogen sensitive area, it's not on a private well, it's town water, so. I don't see the need really to install a tank, a nitrogen reducing tank. I mean, groundwater flows towards the ocean, it's right by the ocean, I don't see the, necessity for the IA tank. I would just reiterate that they need to, report a 1-bedroom use.
Yes.
Notice with the property.
Right, so the addition will not be a bedroom.
No, so there's no increase in flood. It's only 1 bedroom. There's a 1,500 gallon tank there right now, so.
They just don't want to replace the tank.
Well, they would if they have to in
Yeah,
order to
but
make
the-
the project, but it
but they
doesn't make
don't
any
have to.
sense. It doesn't make any
Doesn't.
sense.
Didn't this property try and get sewer to Codfish Park?
Yeah, they tried, I think they went to
And-
town meeting and
Is it through, it's, I mean,
you could throw a rock to where the sewer
Park-
is, unfortunately, but yeah.
pardon, on GIS, it says it's 387 square feet. The house, the living area is 387 square feet.
Yeah, we had 377, but yeah,
Okay,
yeah.
so they want to put another 100 and,
62
60.
square feet.
It's still tiny.
Just-
It's
oh
tiny.
yeah, but that's like almost double the size that it is, right?
Hmm,
Oh, a third.
If it's
maybe.
377 and you're
you're
putting in
adding
160,
it,
it's not quite, it's not double, but it's
yeah,
a significant number compared to the actual size.
Nicholas Amendola is here. He could probably, if you want more explanation on what's inside, but it's really for elbow room, headroom,
Yeah.
a bathroom
I
space. It's
I
not-
just
yeah.
was asking.
Yeah.
Okay. Any questions, Carrie?
Yeah, again, this is the one that we did the 1-bedroom deed restriction. If I remember right, and looking at the
Yes.
notes.
Right.
Okay, and that would be something that we would still want, I'm assuming.
Well,
Yep.
I'm just confused administratively here.
Yeah, I mean, I'm not sure exactly which direction we're going in.
Would we rejecting our past variance?
I mean, I think I could just do a clarification or.
I want to do this legally.
Revision to the previous variance request.
Yeah, exactly.
It's a revision to the previous variance request, but the deed restriction
Remains.
remains.
Remains,
Yes.
Is there any objections to that from the board? Can I make can I hear a motion then?
Can we comment? Can there be comments?
Sure, please.
Should I come over there?
We just never have such,
So many people. That's all we're happening here. the health
Hi.
department.
and I mean, it's a very sparse.
Yeah.
I'm Lisa Soder. I'm one of the neighbors. I live at 13 Broadway. It's a 272-year-old whaling cottage right at the top of the brick walkway leading up from 8 Bank Street. I, like many of my neighbors, are confused by why we're here tonight entertaining a motion by the owners of 8 Bank Street to remove one of the 2 conditions of the variance that was necessary for a second septic variance. I need my glasses. There, other than what was just noted, it didn't seem like there was a change in circumstances in the submission, other than the Zoom connection. I understand that on further research, that's an additional cost. But I wonder if we open this up tonight, why we wouldn't revisit whether there should be a variance at all. What was manifestly unjust before that led to having this variance? Also, from our perspective as a neighbor, and a lot of my neighbors, I think, are on the phone, on the Zoom call. The owners bought a small 9-foot tall, 1-bedroom house in a beautiful and fragile community, historic community, and have sought to build it up and build it down and have the town sewer the entirety of Codfish Park to enhance the value of their rental property at the expense of those of us who live in Sconset, honor the historic nature of Codfish Park and Sconset, and have enjoyed historic Sconset for decades. The plan submitted last week to the ZBA now involve a slab foundation, a 2-story construction project, bringing it up to over 20 feet high, 2 bathrooms and an outdoor shower on a property that originally needed a septic variance for its 1 bathroom, because the underground septic tank was only 18 inches from the house. Having been to over 20 meetings in opposition to the various components of this project with many of my neighbors, I would ask that this request be tabled till the owners first at least demonstrate the good faith to file the 1-bedroom deed restriction that you asked for 4 months ago. Because if you approve the retraction of the innovative alternative system tonight, what's to prevent them from coming back to your next hearing or 4 months from now for asking for a waiver of the 1-bedroom restriction? There's just been an ever-evolving request for different changes to get a more valuable rental property, and it's hurting our neighborhood.
Thank you. Any other comments from the public, please? Why
Um,
don't you go up to the chair?
No.
It's just easier for me
I'm
to.
actually like my friend Michael Kisselbash,
Should I be-
very loud generally. I was going to read something, but my battery just died. And Lisa stole a lot of my thunder. One of the issues I had, oh, I'm sorry, Kit Murphy. One of the things that concerns me, you ruled 4 months ago for a 1-bedroom deed restriction. Now, I'm not a lawyer. I don't play one on TV, but I have to believe it's maximum 2 weeks to get that taken care of. That could have been done long before now. I have no confidence this applicant will be back to waive that stipulation. I guess my question is, if the Board of Health is going to waive the IA septic, can there be a in perpetuity one-bedroom deed restriction put in place before you waive that?
Okay. I have.
And that's it.
I have one other question. There's one other hand, and then we'll take that, and that will be the public comment, and then I'll make a comment myself.
And Sarah Alford.
There's two others.
Sarah has the floor.
Hi, thank you. I hope you can hear me.
Yes, I
Sarah
can. Thank you, Sarah.
Great, thank you. I represent Mina Austin, who's also on a butter, and I have to say I agree with everything that both Kit Murphy and Lisa Soter have said. I think it's really critical that this one-bedroom deed restriction get on record before you agree to further modify this variance. What they're proposing is new construction, and under your regulations, new construction requires maximum feasible compliance. That would dictate the IA system. If you're inclined to modify the variance that you've already granted to waive the IA and leave it as a conventional system, I can understand your reasons for wanting to do that, but I think you need to see that one-bedroom restriction recorded before you do it. Otherwise, it's unfair for the neighbors to have to monitor all the agendas of the zoning board, the HDC, and the Board of Health to see when prior approvals are going to be modified, particularly when there's no notice given. So I really appreciate your time and your care with this. It's very important to the people who live in the area that restriction get on record. Thank you very much.
Thank you, Sarah. I mean,
I got two more, I think.
How much more public comment are you gonna take?
I'm going to just take one more public comment because I have a sense of where I think the board wants to go. One more public comment.
John Shea.
John Shea.
Hello, and thank you very much for taking my comment. I'm speaking as a member of the Sconset Civic Association. I'm a board member, and I'm here therefore representing the 400 homes in Sconset and those residents who are very concerned about the location of this property and the proposals that are being made. And so I want you to say that we believe and know that that particular location at the middle, as you come off of Front Street in Sconset and go down Middle Gully Lane, this house and that building has stood there in roughly a one-story structure for over 100 years. It was many different things. And now they're trying to turn it into, and I understand why, because it's their property, to turn it into a two-story home that would essentially change Sconset forever. So as a representative of the Sconset Civic Association, I'm here to urge you to pay extreme attention to this most historic and valuable, absolutely beautiful part of Nantucket Island, and particularly of Sconset. This is at the very heart of the village, and we must tread very carefully. Thank you.
Thank you, John. Well, we have a history of this board of various boards approving things without telling what other various boards are doing and get ourselves in a real fix at times. And this property is still, the plans have not been approved yet.
May I just
Yeah.
add something? There's currently a lawsuit pending in Superior Court. Judge Gilday has yet to rule. It's my understanding he won't be ruling until sometime first quarter 2025. This is a suit. Some of the nearby owners, some of the abutters have filed against the HDC and the town. So in reality, this property is not even out of the HDC and approved.
I think my opinion, and I'll see if the board agrees, is that we don't have the final plans for this property improvement have not been approved. We did have the deed restriction. There's no reason that we should really discuss future plans until we know what the plans are gonna be. We don't have those plans. But I think it's imperative that we can't discuss this anymore until there's a deed restriction filed.
Thank you.
Can I just respond to some of the comments
go
on
right
behalf of
ahead.
the applicant? Well, I mean, typically, anytime there's a deed restriction, it's made as a condition. And there's no question the deed restriction has to be submitted and recorded, or John's not gonna sign off on the building permit. I think that's kind of a distraction here about this whole deed restriction, I think, because, and there's no way you're gonna get more than one bedroom, and somebody asked about what the variance was, and so technically what we asked for and were granted the first time is a modification to the original variance for the septic tank and the leaching trenches, just to make that clear. So in that modification is based on one bedroom, no additional flows, and I think, the board has precedent, of allowing increases in the size of a structure in maybe not as drastic as a situation, but in other situations. And it's always what comes first, the chicken or the egg. Are we gonna wait 3 years till the courts are done? It's kind of critical for them to keep moving on and get the permits that they're able to get and keep moving forward. Right now, it's in front of the ZBA. This came back to you because of the ZBA's concerns. So I think, and would be happy to submit house plans, more information if you want to continue the meeting to see what's there. But what we're proposing is the plans we'll give you now, regardless of what happens in the future. If they change, then we have to come back,
But if they may change, and I'd be personally, I don't know, I'm speaking for myself, not the board. I'd be more comfortable if I knew what the final plans were here.
Well, those should be submitted to our office for approval. Again, environmentally, the property's restricted to one bedroom, so it's always gonna be restricted. If the board takes them and reiterates the one bedroom restriction, then that'll go through. I'm sure Don can work with this client to get that taken care of. I'm not sure what this didn't happen at the time of the upgrade from the original cesspool that was there. That was, there for probably 100 years, so that's something that, in my opinion, could take place at that time. And the upgrade is common practice whenever you have a system that's under 3 bedrooms. Again, I would just kind of go back to environmental. This is going to stay at one bedroom.
One has to stay at one bedroom.
I mean, the problem isn't, are you people afraid that they're gonna change it and ask us to give that, to add a bedroom?
I
Once
think,
they get that restriction on, it's a 1 bedroom restriction, that's it, they have to live with that.
right, I understand that. What I don't understand is why, once you said, we want the 1 bedroom restriction, why it wasn't immediately placed on there. Why haven't they done it and are now asking for a variance? Not for the 1 bedroom, but they're asking for a variance for the IA septic. But at the time, you gave them 2 conditions. Why can't the, excuse me, I'm exhausted. Why can't the 1 bedroom deed restriction go on before you give the variance? And there's a canard that we're gonna have to wait 3 years for the court. We're not. Judge Gilday was here within the past 2 months for a site visit.
That's fine. Okay.
Can we ask to be continued to the next meeting? And in between now and the next meeting, we'll record the 1 bedroom deed restriction.
Okay.
Why don't you do that?
Yeah,
idea.
I think we're happy to do
That's a
it.
good
Thank you.
idea.
Yeah.
That will
Let's
make
get that done.
everybody,
Yeah,
Thank you.
that will,
Let's get that.
everybody
Yeah, that's the
comfortable.
easiest
Yeah.
thing to do.
yeah, if that's the concern,
Yeah.
then that's fine.
I
We have
do
no
feel
problem
like
with that.
the property has been in the news with them they came to us wanting to hook up the septic or wanting to hook up the sewer. Then there was a article for town meeting
I know.
to get, so I do think
I like,
that it concerns me that then we said you need this deed restriction and it still wasn't, I mean, that that's concerned.
I think it, I will take a motion that we continue this agenda item pending the filing of the deed restriction.
I'll second.
You make it. Well, someone will second it.
I'll second it, yeah.
Second by, all in favor, Jim, Meredith,
Yes.
Ann,
Yes.
Carrie,
Yes.
chairman votes aye.
It will submit the house plans too.
Thank
Next
you.
week.
Thank you for this. Thank you for this.
Thank God.
You're not up for this.
Everything happens
I
here.
get more.
Again, try to arrange.
You're having a tough day.
You're leaving?
The Board of Health, you know, what's happening is.
I have a bag on this one though.
We're getting stuck in architecture,
Yeah.
swimming
History.
pools, history.
Yeah, it's, we
But
have
it's
to remember who we are.
Carrie's point too about one bedroom here, one bedroom there. It's like one swimming pool is environmentally sound if it's cared properly. But over 1,000
25 or not.
or 25
Yeah.
or thousands of them, then you begin to worry. It's like
Yes.
one bedroom, a little bit more nitrogen, and then, but if we're adding 1,000 bedrooms, anyways, we have to get our handle on it. Esther Island septic variance request.
You still here?
Yeah.
Yeah, the last one though.
Moved a little.
You should.
I'm
You should
0 for
run
3.
The board next
No.
time. You can actually
Yeah,
understand this.
then I won't be able to do all this. Again, for the record, Don Bracken, the owner Scott Akins is here. And attorney Kevin Dale is also here for this property, but hopefully we don't need him. So this property, is on a technical failure for being in the Nantucket district, requiring an IA system. Other than that, the septic system that's there, 1,000-gallon septic tank and a 2-bedroom leaching trench, has passed. So what we're asking for is a variance, to 332.22, not to have to install the IA system in this particular case. And I'll just kind of go through the variance, letter. Number one, obviously, we would restrict this use to 2 bedrooms and also restrict it to seasonal use. The property does not have any electricity out on Esther Island, so it'd be very difficult to maintain a IA system out there. The property in total is about 8.5 acres, which under Mattica requirements could handle up to 37 bedrooms. Plus, if we subtract some of the wetland areas and erosion, but you get the picture. One other thing I found interesting that I put in the letter is that this property is actually outside the Nantucket watershed area from the original report in 2015 that was done for total nitrogen in the Nantucket Harbor. So I think in this case, any effluent flow goes out into Nantucket Sound, not necessarily back to Nantucket Harbor. I think, it was included in the Nantucket area because it is part of Nantucket, and so the whole Esther Island was included in that. So we think it's probably a very rare situation where we think that, the IA system would not be a benefit in this particular location. This was actually partly triggered because there's currently a shed under construction on the site right now. That was flagged, and I don't think it came through the Board of Health office. But that shed is just for storage. There's no plumbing connection or anything for it. And with that, I'd be happy to answer any questions. Thank you.
Comments, John?
My feeling is that it is in the Nantucket Harbor watershed, more specifically the tight tank district. Unfortunately, there's some, I know it's been pumped before the system, but obviously, there's some logistical struggles with maintaining the system over there. With that said, I think that the current systems is non-compliant by 1995 code. So by that regard, I think they could upgrade to at least a compliant Title V system right now, which would be a 1,500-gallon tank. I believe the leach trench is only 6 inches pipe and stone.
How old is the system?
92, I think. Yeah, 1992 it was installed.
And it works okay?
Yeah, it works fine. It passed the Title V. It was just a technical failure because of the IA. The leaching trench does have a 5-foot separation of groundwater. A variance was granted for that back in 91 or whenever the system was approved and designed. Again, it's only 2 bedrooms, so even though it's only a 1,000-gallon tank, that, you know, the calculation for the volume of a septic tank is 2 times the flow, so that's only 440 gallons. So it's more than twice what the calculation is. But as you know, Title V has a minimum size of 1,500. So on a science basis, the septic tank at 1,000 gallons is still big enough. And again, we don't feel that, you know, by replacing it, we'd be replacing it with something, you know, similar to what's there. And again, a bigger septic tank isn't going to really provide any more treatment. And given the location of the area, close to the dune and near the wetlands and everything else, it just doesn't seem logical to dig it all up and just put one back that's very similar. But really not much treatment advantage over what's already there.
Carrie?
Yeah, on the Mass DEP website, when they have the IA systems, like 5 pages of different types of system. I don't know them all, but I'm just saying, have all the alternatives concerning IAB been considered? Do they all require electricity? You know, could we talk about the one on Washington Street a couple months ago that use wood chips and stuff? I mean, there are different IA systems out there besides the ones that we traditionally have been using on the island. Has that been explored?
Yeah, I don't know of any IA systems that are approved that don't require electricity. It's either they need an aerator pump or they need pumps to spray over media and that type of setup.
They not have a generator?
I don't know. That's a good question.
Or solar powered?
Scott, you hear that question?
I didn't hear what the question.
Do you have a generator or the solar power?
There's a generator, there's antiquated batteries, with old solar that barely run a couple lamps. I don't know what exact wattage or how much it's producing. The cottage is really like a summer cottage for me. I live in Nantucket, it's 207 Nantucket Road, and just go out there kind of on weekends and stuff like that. So to replace the septic, I just feel there would be more environmental damage with big machines and tearing out the old tank and clearing out, you know, environmentally sensitive areas to install a new septic system.
Did we get identification?
I'm sorry, Scott Akins.
Pleasure of the board.
What size is the tank?
It's a 1,000 gallon tank now.
And if you comply to.
Yeah. Quick question, Carrie here. It says that the deed will be restricted again, just like the one on Bank Street. I mean, would it be better to have the restrictions in place and then we can act? Because right now it's like they'll do it, but we have, you know, to kind of change the order, get the deed restriction, so then we know exactly what the limitations are that we're working with.
That is kind of tough because,
Yeah, I know.
you know.
Gentlemen.
Chairman, Kevin Dale representing Scott and here with Don. I'm the manager of the LLC that owns the property. I'd be happy to draft deed restriction and a seasonal use restriction that the Board of Health can look at and be ready to record it as soon as you want me to. I just want to say, not to belabor things, but there's manifest injustice, it seems to me, when there's no electricity, when you can't run an IA system, you'd be required to do one. And Scott said to disrupt the property with heavy machinery and everything else wouldn't be right, wouldn't be the good thing. You can only get there by boat or in fact, by four-wheel drive vehicles escorted by the town. It's just a little fishing shack.
Yeah, I know.
So it's not much. And I think it's reasonable to have the conventional system, make sure the property's limited, seasonal use, limited to 2 bedrooms by virtue of a permanent deed restriction. I'd be happy to put that together.
Thank you, sir.
I mean, since it is in Nantucket Harbor watershed, it is subject to an inspection once every 5 years, so.
Yep.
Yeah. We'll just have to maintain that happens.
Yeah.
The inspection happens.
You can borrow my canoe. All right, okay, motion,
Yes, I make motion to approve the variance.
you'll make the motion to approve the variance with a restriction.
Yes.
Do I hear a second?
Second.
And seconds, all in favor, Jim,
Yes.
Ann?
Yeah.
Meredith,
Yes.
Perry,
Yes.
Chairman says aye.
Thank you very much.
Thank you.
I got one. Yeah, that's not too bad.
Freed up that.
You got one to not do any. You got one to not do any work.
Yeah.
Yeah, we're not changing these.
Septic variance request, one lot Falwell.
This is for a shared system, that happened out of a subdivision of the property. I spoke with Paul earlier this week and a little confused if there was a previous subdivision done apparently back in the 90s that showed 2 lots. A new system was just installed 3 years ago or so, 3 or 4. And a new building was built on one of the lots. It seems to have now kind of gone back to planning board and officially been subdivided. So anytime you have a system and they subdivide and there's a building built within 5 years, it's required to get a variance from the Board of Health for a shared system. So the fact that they built within the past 5 years, it's assumed that that system was constructed for new construction and requires a variance from the board. But that said, any shared system has requirements of covenant and easement, ownership of all the components of the septic system, financial assurance that it'll be repaired, basically responsibilities for repairing the system. It's inspected once every 3 years. So those things are all in place. Shared systems are kind of, you really want to avoid them as much as you can due to, complications of who's paying for what. And it kind of limits the Board of Health's authority in that situation as far as putting a lien against the property if it was necessary. Honestly, I don't think we really get to that point. But it does limit the power of the Board of Health. Right. And sometimes these things come down to the lines on a piece of paper.
So what is the situation right now, the way it stands with the system?
It's just installed. Is there a CSC in the?
Yeah, just identify yourself and speak.
Sure. If John's all, you all set, John?
Yeah.
Okay. Thank you for the record, Paul Santos with Nantucket Surveyors. With me is John Bartlett, the principal and owner of Galley West LLC, who holds title to the property. And then Arthur Reed, who is an attorney for John, is also on the phone. So what we have here is, this is a parcel of land that was subdivided back in 1993. It's been 2 lots that were approved by the planning board at that time, but essentially has been used since the original subdivision as 1 parcel. There is an existing single-family dwelling on the property, and recently a garage was converted to a second dwelling and moved from another piece of property on island to this piece of property. The lot itself has a fully code compliant 6-bedroom system that is serviced by both the dwelling and the secondary dwelling service the system. The original lot was subdivided, as I said, back in 1993, based on the regulations that were in effect at that time. The 93 predates the current 1995 septic code in which shared systems are an allowed use under the current septic code, provided you can meet a number of different items or criteria. That's why at the time in 93, it wasn't developed as two separate lots. Recently, Arthur was successful in going back to the planning board to have them recognize that this was two lots that could be separated for the purposes of the planning board. And now we're before you to validate a shared system easement on the property. Part of the shared system, and I think John and I kind of went around a little bit too on the definition of shared systems within the code. There are different provisions within Title V for shared systems. There are 2 or 3 provisions by which variances are not required. We were of the opinion that the new construction component of the Title V is a bit ambiguous, I think, to say the least. So that's why we made the decision to come before you under John's direction. So we've met all the requirements of Title V with regard to the use of a shared system. The benefit of a shared system in this particular case is it allows us to put, rather than 2 systems on these 2 particular parcels, we have one system at the furthest most distance we can get from Hummock Pond. So we're well in excess of 300 feet from the pond. If you'll look in the plans that you'll see that you have the 2 dwellings and the system is located in the farthest most point it can be from Hummock Pond. It meets, again, all of the other requirements of both the state code and the local code. And the reason we're here is just essentially to validate the shared system provision, which is an allowed use within Title V.
And they'll still need the shared system to be approved.
Oh, sure. Yeah, John had mentioned, again, the shared system approval comes with a validated Title V, which is a Commonwealth form easement between the 2 parties. Also provisions for maintenance and so forth with regard to that. And then Arthur is in the process of preparing all that paperwork that will then be submitted to the board for review.
Questions from the board? Jerry?
Yeah, so both lots are owned by the same party, correct?
That is correct.
Would it be easier just to blend the properties rather than coming for us to kind of do the forcing the shared septic system? I mean, it's supposedly being used by one group of people and design that in terms of its design. So wouldn't that just be a better route?
Well, that's the route that it is now, but the intent was to always have 2 lots and to have available and marketable 2 lots on the particular piece of property. So in order to do that, the shared system is the required route going.
Well, yeah, to keep them, yeah. So essentially, they don't want to make it one property.
Correct. It's been used since 93 as that, but the time now has come that they're looking to utilize the 2 lots that they had approved back in 93. Nothing will change. Nothing will change with regard to how this property is now has and will be functioning in the future. It's just the ability to separate the 2 lots.
And if one of the lots were to be sold for whatever reason, you know, the need comes up, what happens?
That's the purpose of the shared easement. All these easements, the shared easement and all the paperwork is put in place to reach that goal.
We just did one of these a little while ago.
Yes.
And the restriction we put on it was if anything changes on either one of those lots, whether it's sold or the titles in someone's different name, you have to come back to the board before you can do anything.
Well, that was kind of a unique situation, that one. That was not a, if I could, and let John, that was, I'm familiar with that situation.
Yes.
That was not kind of what this situation is.
Well,
Yeah.
we'd still want to protect ourselves by saying if one of those lots are sold, before anything would happen to either one of those lots or to that system, they would have to come back to the Board of Health.
Well, that's why we're here today.
Okay.
So we're here today because of that reason.
Right.
Yeah.
He's essentially
Okay.
there because of what we asked the other people to do.
Yeah.
I see a hand up and then we'll ask for the. We have two hands up.
It's Arthur.
There
Can
you
you
go.
hear me?
Yep.
Okay, thank you. Yeah, just to clarify the point, I'm, as Paul mentioned, counsel for the owner in this case. And obviously the point here is to enable one of these lots to be sold, which is pending at the present time. And the paperwork will all be in place so that when the two lots are in separate ownership, this arrangement will be in place. We want to get it approved now, and it'll have to be recorded before the closing takes place, so that the arrangement with the shared system, as per the Title V regs, will be in place on a permanent basis once the properties are in separate ownership.
Thank you, Arthur. And there's one more hand and then we'll ask for votes. No more hands.
Can I ask a question?
Please.
So, could we say that when it is sold, that that an agreement is filed with the Board of Health of like how often the system will be?
So
It's
by
a
Title
requirement.
V, it needs to be inspectable at the time of property transfer as well as every 3 years.
Yeah.
But what about get it like sucked out?
I mean.
Or is that not- I'm just-
That's not a requirement.
Yeah,
It's
it's-
more of a maintenance.
Is the concern that it's two different properties, and so who's gonna be responsible for caring for the septic?
Well, that's part of.
Yeah.
So I guess,
part of the
is
agreement.
there a way to put in sort of that there has to be an agreement about caring for the shared septic?
Well, that's essentially what Arthur's preparing.
Okay,
That is a requirement. It's called the financial mechanism for it to.
So that'll be part of the sale agreements and Arthur's doing those papers. Carrie, one more comment, then we're gonna move on.
Yeah, there's a specific DEP form for this easement, which will be followed, and it covers the whole point of ongoing maintenance and all of that.
Okay, board, may I have a motion? Anyone wants to make a motion? Carrie?
I'm not comfortable with it.
Okay,
Tell you the truth, my motion would be to deny.
are you making that motion?
I will make a motion, yes.
Is there a second?
What's the motion?
Carrie's made a motion to deny the variance. There's no second, then we need another motion. I hear no second. Do I hear a second to approve the variance? And
We don't have the motion to approve the variance yet.
you're gonna make it,
Oh, all right, yeah, okay.
okay? Because there was a motion to deny the variance, but there was no second.
Right.
Since there's no second, then you can't do anything.
Okay,
Do I hear a second to approve that variance?
second.
Mira seconds it. All in favor, Ann?
am I
You're
voting to approve the variance?
Yes, you're voting to approve your motion to approve the variance.
Yes.
Meredith,
I said yes already.
Jim? No. Carrie?
No.
No. Chairman says aye, 3-2.
Thank you.
Motion's approved.
Thank you very much.
It's been a rough day for Jeremy. It's bad.
5 Lane septic variance.
Are you here for that one too?
Yes.
Oh, good. I have to
And
give
then
you,
Paul, I'm gonna have Pauline come up.
I have to give you a phone anyway. Real good
Okay.
told me to come.
All right.
Good evening.
Good evening. How are you?
Hello.
Good evening. Paul Santos, again with Nantucket Surveyors on behalf of the property owner at 5 Wero Lane. With me is Pauline Croach, and also Arthur Reed represents our house. So briefly, our house is a nonprofit membership organization designed to provide a connection for high school age students and their peers and adult mentors. They serve Nantucket youth by providing a safe, nurturing environment that will offer students a place to establish specific goals for personal growth, inspiring them to reach their full potential. They've been located at 5 Wero Lane since December of 2021 and are hopeful that they can install a commercial kitchen at this facility to prepare meals for the students and guests that frequent the facility. 5 Wero Lane, that some of you may be familiar with, it was a residential property. It was known as the Wedding House. It's a 15-bedroom house that was owned by Jacques Zemicki at the end of Wero Lane. In 2021, our house purchased the property and essentially to provide a place for Nantucket youth once they get past the Boys and Girls Club age, to have a place to go and have programs available. And I think Pauline will speak a little bit further to that. The reason we're before you today is they would like to add a small addition to the structure. I believe it's approximately like 6 feet in depth by about 12 feet in width, which will be a small commercial kitchen for the facility, for prepare meals and things like that for the kids who attend. Under your definition of new construction, there is a provision that says any new construction, which could be an increase in flow, increase in square footage, requires that a fully code compliant system be placed on the lot. This system that's on the property is a older leach pit system with a septic tank. It predates the 1995 septic code, which is the current code. So that definition of new construction would require that system be completely taken out and replaced with a current code compliant system. Now that system passed an inspection at the time of our house's acquiring the property in 2021. We have every reason to believe that it is still functioning in a proper way. And what we have done is looked at how our house is occupying the facility. And I submitted a supplement, which is the sewage disposal design flow memo that we prepared and submitted. And essentially what that did was we went through the current Title V and looked at how we would calculate design flow, because they're not typically using this as a standard 15-bedroom residence. And what we've determined, or what we feel, is that we've justified the fact that how they're utilizing the building doesn't essentially increase the flow to the septic system that's out there today. It's still in line with what a 14 or a 15-bedroom septic system can handle. That being said, that still leaves us with the fact that we are increasing square footage, and under your bylaw, that's the definition of new construction. Typically, you would require that system, even though it's functioning, to be taken out and replaced. That is a significant cost for this particular property. A 15-bedroom system, it's a very large system, would be a significant cost to add this to the facility. The property is not located in any of the town's watershed protection districts. It's not located in a designated DEP Zone 2, and that the level of environmental protection of this, utilizing the system that's functioning now and putting in a new system for the simple addition of a commercial kitchen on the property, we felt was a justified request of our house to come before you. Couple notes that with regard to the property. The property currently is not, for whatever reason, both this property and Jacques' house are the only two properties on Wero Lane that are not in the sewer district. The town does now have a sewer line in South Shore Road. Unfortunately, that line doesn't look like it's going to be activated in the near future. I think there's a town meeting article for funding because that line, although it's in the ground, can't be activated until there's some corrections made to the pump station, which requires a town meeting approval. So I suspect that there's not going to be sewer in South Shore available within the next year or
There's a
so.
potential, a lot of use for that sewer coming.
Yes. So, I mean, we would ultimately love to be able to tie to that sewer, but I don't see that happening in the near future, in the time that they'd like to use this kitchen. So that's essentially the gist of the application. Although, we would like to utilize the existing system, we would still be required to put in a 1,000-gallon grease trap, because the kitchen flow, this kitchen, oddly enough, is completely isolated with regard to the system. It's on its own building sewer line that feeds the septic tank. So we could put a grease trap, which would be a 1,000-gallon grease trap, would be put in to service the commercial kitchen. The commercial kitchen would be completely approved and have to be reviewed by the Board of Health. They have most of the equipment already for the commercial kitchen that they had received previously. And that's essentially the request before you. I'll let Pauline briefly, and I know it may not be pertinent to the variance, but I think it is important to know what they're doing, you know.
I'll make it brief.
Yeah.
And I think many of you know about our house.
We know.
You do. And so it's, we have anywhere between 10 and 15 students at night. We're doing dinner 3 nights a week at the moment, which are being cooked at the school and then brought over to the house. And our dream is to be able to have cooking lessons and have our students be able to purchase food from the farms and the shops and cook the meals. And we'd like to be able to do that 5 nights a week. So we're looking forward to moving forward. And we've been working with John's office for 2 years now, just going back and forth. And I think with your help, we would be the next step forward.
Right.
So.
Comments from John?
So yeah, I think I kind of see 2 routes with this. I do want to kind of make a clarification first with the letter that was submitted, that was emailed to you before the meeting, the calculation flows. I kind of need clarification. Paul, are you saying a bedroom 75 gallons per day?
No, what we are saying is the derivation, currently, a bedroom is 110 gallons per person per day under Title V.
Correct.
But when you go to the basis of how that was calculated, of how the 110 came up, we go back to the report that was commissioned by the Commonwealth of Massachusetts to develop the current Title V. And they decided that's how they came up with that number. So we're using the numbers that were developed to get to that point. And again, we're saying 75 gallons per person per day with an assumption of 1.5 persons per bedroom. In this case, they're using the bedrooms as a 1 person. Basically, 1 person is occupying the bedroom. So we're using kind of the empirical data that the state used to come up with the 110 gallons per person per day.
But 2 people could be in the bedroom?
That's not how they're typically using it.
So
but-
it's only in the 7 weeks that we rent it. The rest of the year, there's no one in the extra rooms. We have our property manager living there, and our 4 teachers. The summertime is the only time we are still required to rent it out for the income. And we have another contract with the Chicken Box, which is with their bands, and typically it's 1 band member. They don't typically travel with a partner. And so it's 1 person in a bedroom.
Okay. So there's 1 hand up. Then we'll ask the board.
It's carried.
Oh, it's Carrie. All right.
Okay, so, yeah,
Comments from the board?
the usual person. So, I had, maybe I may have just answered to one question, because one of the questions was, is the house ever fully used? And I know that it is rented out during the summer. And, so it sounds like that during the summer that all 15 bedrooms could be occupied during a 7-week period. Will the commercial kitchen be used by others or rented out to other chefs or anything during its time?
That's not our intention. We really want to use it for the program, and eventually we would like the program to be year-round so that we wouldn't need to even rent the house out. But currently that's not the plan, to rent out the kitchen.
Okay, good. And then we talked about, would it be feasible to have the septic system, the current system, at least checked to make sure it is functioning? It sounds like the data might be a little old, and with the sewer hookup kind of approaching, it kind of don't want to make that expensive. We do want to know if the system is working properly. Is that something that could be considered?
Yeah, we actually, I think in my initial attachment, we did offer that even though it was inspected during the time that it was sold, that we would do a current inspection before we moved ahead with this, installing the grease trap, if the commission so felt the variance was warranted, yes.
And then, I'm kind of assuming that, if and when the town, the sewer hookups can be done, that would be something that the, would be pursued then, rather than continuing with the septic system that's outdated.
That is correct. I had a conversation with Sean Reed regarding that, and we would be willing to do that when the time was there.
Okay, thank you.
Any other questions from the board?
I have a question. So you, you say that 15 rooms are never full, so you're gonna restrict the amount of people that are in that building?
We even with the full, our numbers basically would say, even when they have, say, one person per bedroom, so all the 15s are being used and the kids are still there, we're still meeting the flows that system can handle. But I think that's up to Pauline on how they typically rent to one person per room is how they typically do it.
The only thing I don't understand is how you can keep it to 75 gallons instead of 110.
Well, it's actually more than the 75. It's a 1.5. So it's because that's how, when they look at how they come up with those numbers, that's the numbers that were used.
In 1996.
Yeah, that's what was used to develop the 95 code.
That's 30 years ago.
So, well, the state hasn't updated that code since then.
No,
And the
but
data they used to develop the
what I'm
code was
saying,
that.
Title V right now is 110 gallons per bedroom.
Yeah,
And
it
you've
says,
got 15 bedrooms, so you should end up with 1,650.
correct, that's how the system is sized.
You've got 550. You should have 1,650, right, and you got 550 for a total.
Yeah.
So we have to accept that, right?
There's the 16, here's the 1650.
Yeah,
Yeah.
it's a 15-bedroom house. It's a 15-bedroom septic system was designed. When we review house plans, we don't say, oh, you can have 8 bedrooms, but we say, we're only gonna use 4. That's why you design a septic system to that size, so it's really hard to.
So you're okay with that?
I would suggest removing some of the bedrooms in the house, to allow for this. I would be okay with the 13 gallon per day usage, as a mess hall, you said, for 30 campers or students. But so to me, you'd have to get rid of some bedrooms in order to accommodate that 390 gallons per day of mess hall use. I would say that the mess hall, it would strictly be a mess hall. It couldn't be a kitchen that could be rented out for, food truck or something, or leased out, because then, in my opinion, you'd be producing a lot more food, washing a lot more stuff, using a lot more water. Maybe have a contingency plan in place, a plan ready to be approved in case the system did fail, if it's not required to be upgraded.
If I could just go back to
Please.
Jim's question. So Jim, the 110 gallons per person, the 110 gallons per bedroom, okay, basically is an assumption that there's 2 people per bedroom. It's 55 gallons per person per day. So what we're saying is, we're giving you 70, we're saying it's 75, which assumes there's 1.5 people per bedroom, which we know is not really happening. So we've actually got a set factor of safety there. So the 110 assumes that there's 2 people per bedroom.
Yeah, but what I'm saying to you is I could build a house and say I want a 4 bedrooms, 4 bedrooms, but I'm only gonna put 1 person.
Yeah.
1 person in every bedroom, and the rules say, doesn't matter, it's 110 gallons per room.
So,
And all I'm saying to you is, if we give you the permit, we're gonna respect you selling, and we will agree to 75 gallons per room.
So I recently got to see our house. It's amazing. they're not using, there's what, 5 people that live there, but like the bedrooms on the first floor are all being used as like an offices or a music room, a room for kids to do homework, a room for kids to, I'm trying to remember what they all, so not like, they're not even set up as bedrooms. They have like a desk. So each room had a bathroom, but they are not being
Yeah.
used in that way. It's, if you have a chance, and Pauline will show you,
Yeah.
it's really cool. And then the kids come and are there for 4 hours, 5 hours a day, 5 days a week. I
5
don't
days a
remember.
week. Yeah.
So it's, I just wanted to point out because I think that it is a much more limited usage than what it was being used when it was
Absolutely.
a wedding venue.
There were people packed in there like you have no imagination
All right,
for weddings.
so let's move on. I need a motion to, maybe some of the motion to, approve the variance on the condition that the system is inspected, re-inspected.
I'll make that motion.
Motion is made
And I'll
by-
second it.
Second by Meredith. All in favor, Ann,
Yes.
Meredith,
Yes.
Jim,
All right, yes.
yes, Carrie,
Yes.
Chairman votes aye.
Thank you very much. Thank you. Appreciate it.
Thank you indeed.
And as an advocate for children, I know coming up, you've got the camps, the water camps, and I just hope you support them because it's just wonderful, all 3 of them who are represented. So
They're wonderful camps. We have to deal with the law.
I know, but I just had to put my 2 cents in. Thank you.
Yes, that,
Wiggle that.
they. We talked about that. Read it up. Read it up. Then you might at the end, well,
Okay.
for questions. All right,
Oh, I have to recuse myself.
all of them? Or just-
Well, I work with the first 2.
Oh.
So,
Nantucket search for camp variance.
Speak on this.
Yeah.
You want, do you want Heather's gonna speak on behalf?
Oh,
of-
yeah.
Oh, yes,
Or do you-
oh, yes, yes.
However you guys want to do it.
No, no,
You want to
Okay.
go first?
no, do you want
Either way, you can set that.
to? Okay, sorry. Nantucket Surf School, and we have. Go ahead.
Okay,
Why
this
don't
is
you just-
Gary. I'm Heather Nardoni. I'm a public health inspector. So in, I think it was the last meeting, we went through the camp presentation of ways that we can make the variances more suitable and more feasible. Gary's following all of the things that we discussed. And so I believe that we should grant the variances for, it's basically all related
Sewer, water.
to bathroom and sewer and water. So.
Questions from the board? You have any comments?
As I said, as Heather said, I mean, she tried to streamline a lot of the variances, so, which is great, and I appreciate that, working with us. Obviously, we do not have running water out there, but most of our activity is in the ocean, so, and there are porta potties, so, most of the students are only there for an hour, but some will be there for 3 hours. Yeah, I have obviously no ability to put water at Cisco Beach at this time, so.
Questions from the board? I don't see Carrie's hand up this time, all right. Jim, anybody? No questions? We have motions?
I'll move to approve the variance.
The variances as requested, as
I'm gonna
requested.
do them all. We're doing certain.
I would just say as requested in the application.
As requested.
Do I hear a second? Second, anyone?
I'll second.
Good.
Okay, any further discussion? All in favor, Ann,
Yes.
Jim,
Yeah.
Carrie,
Yes.
Chairman says aye. Thank you.
Thank you. Thank you.
Next level water sports.
No, it's.
Axe surf school, yes.
Do you want to come up here? So, yeah.
Just state your name and. for the
Yep.
record.
Gavin Norton, owner of Baxter School.
Right.
Do you want me?
Go ahead, you can
Okay.
explain which variances you support and which ones you don't support.
Okay, so Ag Surf School and Nantucket Surf School applied for the same exact variances. The only difference between the two camps, and I'll have Gavin speak on this as well before, but is that he is requesting that he doesn't need a tent for as an infirmary. Nantucket Surf School does have a tent, has also always had a tent, and operates on a different beach. So I think that we need to keep things consistent with all the camps, and that granting this variance would create inconsistency between what we're granting.
Yep, so I have a tent. I guess what I was against in the last meeting, which I was pretty vocal about, is in no way do I feel comfortable putting infirmary on it or something that says it's a medical tent. I'm first aid, CPR, lifeguard certified. I can't treat everyone at Nobody Beach. I mean, there's 2,000 people a day. When you walk into Nobody Beach, you can't see the lifeguards until you get to the water's edge. It's an issue. If I have a big tent that says infirmary, I'm gonna be giving out a lot of Band-Aids and they're really expensive. So that's just why I asked to not have it. The tent I have is for shade for employees and people that are there. It's also really windy at Nobody Beach. I don't really have a lot to tie it to. So if I have a 100-day season, I can go 60 days without having it up. If it's too windy coming up off the hill, it hits us and that makes for needing an infirmary rather than having an infirmary. So.
Okay. Comments from the board, questions?
Can I make a comment? The code states that if it is an infirmary, which is what it would be, that it has to be labeled. So that's a separate thing. A suggestion would be infirmary for Ag Surf School only, and it doesn't need to be red cross, like big bold letters. It just has to be labeled somewhere.
Yeah.
So if you could just, like, it doesn't need to be the most obvious infirmary, like hospital beds.
Are you comfortable with that?
Yes and no. I just like my biggest worry is just I take the tent
I
down a lot.
understand, I would be, there were two. I
I
see
was gonna say,
someone from the audience speaking,
Hi, Mary
a
Leffler.
citizen.
Yeah, speaking as a private citizen, I just think that Gavin is right. Everybody will. So could it be just a little note inside of it that says infirmary? Like, this seems kind of like a.
I also have a
I would
26
go to
foot
John for that. not me.
enclosed trailer that you can walk all 26 feet of it. It's in the shade. It's safer than a tent. It's in a huge trailer. I fit every single one of my employees in there if there's a thunder and lightning storm, plus every lesson or anyone that's on the beach runs into this thing. I'm not asking people to go into it. It's just when it starts to rain and thunder and lightning, people run into it.
And board have any other comments about labeling?
Yeah, I mean, Gary, what does the regulation say about labeling? A lot of times there'll be very specific, letters got to be X number high. Is this just, what does the regulation say specifically about labeling? Because if that's an issue, what are we dealing with?
So I can find the exact, but from my understanding, it's under the scope that says infirmary and it just says labeled infirmary. But I can find the actual language if we want to, but
I guess
it might take me a minute.
Can we get a variance on the labeling?
My biggest worry is just if it's a day where it's blowing 40, which Gary can probably attest to, all of July was blowing, gusting 30, 35. Great for John, bad for us.
Yeah.
If I have to have an inspection, I have to have my infirmary tent up, or I have to have it up every single day. I've used sandbags, I've used tie downs, I've seen it take 3 chairs, 3 tables, and weighted bags. So I
I get a sense the board would want you to put a tent up, but if we can give a variance to a label,
Yeah, I mean,
I'd be comfortable with that. I don't know about the rest of the board.
There's not anything in
Gonna
that
argue that
tent
super hard.
different if it's labeled or not, right?
Yeah,
is like the
Yeah,
inside of the
it-
trailer,
it's
if I
the
have like
same.
an area that could be like the infirmary? Like if it just needs
Yeah,
to
do
be,
that.
no,
John,
I haven't seen it. Is it ventilated? I mean,
no.
yeah, yeah, there's
Ventil-
vents, there's like, not like forced air, but you can close it. And you could live in it if you wanted to,
There's
there's,
some flaps that come up with the.
no, it's just like the back corners have plastic vents. So like there's airflow inside of it, it's not a pressurized cabin.
But the issue, from my understanding of the trailer, and I might, because I get all these camps kind of meshed in my brain,
Mhm.
is that there's storage in there, right? So it has to be separate than like a place that has surfboards and life jackets and.
Yeah, like the life jackets are built, or sorry, the surfboards are all built into one area that's protected. And then the whole other area is just a row of wetsuits. Then there's a gap.
and that's the infirmary area. So
Could be.
put a label there. That
Okay.
This is the infirmary,
Sure, I mean, like if that's what you guys are okay, I don't want to,
because then the people to me, if you, in the area, in the tent that's your infirmary, you put a label that says that's infirmary, the infirmary is labeled
Mhm.
for people that are going to the camp, because they'll be coming into the tent. So why don't we just do that?
Wait, I'm kind of mixed up because you were talking about using your trailer. That's
Yeah.
not a tent.
no, I mean, I do have a tent. I'm just saying, that's where I'm just trying to be careful, like if I don't have my tent set up that day and I get an inspection, I'm gonna fail.
Well, then you will fail. You'll have to have the tent set up. I think what we're saying here is we want you to put up a tent
Just put the sign
and put the
where the
sign.
infirmary
and-
is.
Okay,
Your instructors know, the kids know, everybody knows.
Everybody knows.
Where it is, and then inside.
Then
I feel
inside-
really, really strongly that we have to be across the board. It cannot be a little bit for this and a little bit for them and something different for
And
somebody
this
else.
makes, this makes it
is what it
consistent.
is.
okay,
You
like,
have your tent,
yep,
and inside of it is a specific area that's called the infirmary and labeled as such.
Okay.
And that will have to be up all the time.
And possibly just, on the outside of the tent, say, put surf school, just so that people know that that's not a public tent. Because the reality is you go down the beach and, there's something identified, this is private, essentially like private property. Inside, you can have the sign that says infirmary.
Yeah.
Um,
Surf school on the outside.
yeah, the tent's label, I'm just saying, in
And
which
put-
I like.
Take
go
an
to-
area inside the tent. And label it infirmary.
Yeah, I'm not disagreeing and saying
Yeah.
I don't think I need it, I'm just saying, without having anything that says infirmary. I give out med supplies all day, every day, so now having infirmary, I am going to be giving.
Now you're gonna be, you're.
Your label's gonna be inside the.
Yeah, your labels, just
Okay.
don't worry about it.
Okay.
Yeah.
So
Put it inside.
I think he, he would like to know that if inspected and the sign was on the inside of the tent, that he would be okay with it, that wouldn't flunk him.
Okay,
And-
so it doesn't have to be like a big visual sign.
No.
Okay, that's what I
No,
was worried
okay.
about. Yep,
So do we have a motion to approve the variances? Which is, which is including.
No. Because one of the variances would be not having a tent, so.
No, that would include that he will have a tent.
Yeah.
yep, have a 10.
So we're approving the variant,
What are the specific variances we're approving?
For access.
So the
That's
variances,
where we are.
you're basically making a motion to approve all of the same variances as Nantucket Surf School in relation to bathroom, sewer, and hot water.
Yes.
We are denying the variance
For
with
the
the
tent.
tent because he's
So which
getting
one
a
is,
tent.
which one is ten, which of these numbers are?
Can
Okay.
I look at it? I'm sorry. Yeah,
Okay,
Okay,
let's
thanks.
do two motions.
It's
I'd like a
430 430-161
We
is
deny the
10.
variance for the tent.
Deny the tent and accept the plumbing ones.
Okay, that's your motion, Carrie. Do I hear a second?
Second.
My motion.
All in favor, Carrie,
Aye.
Jim,
Aye.
and
Yes.
Chairman votes aye.
I don't have to come back for it, right? the other one?
No.
You're done.
You're done.
You're good.
Done.
The only thing is the variance for the tent is denied. Your other variances are accepted.
Perfect.
All right. I may see dinner yet.
I'm like, no, you're fine.
Oh, you're back? Yeah.
Yes.
One more?
Next level water sports camp variances.
So usually when we've done this, we pulled them up, so I didn't print all of the variances, so that was on my bad.
They're right here.
Okay.
That the.
No, this, it would be on his, what he submitted. Yeah,
They're right. Yeah, I have it here if you want to see it on the.
okay, no, this is great. Yeah.
Third page.
I'm old and I had to have paper.
Yeah, no, I agree. I'm going off of the code here, all printed. Okay, so in relation to next level water sports, they are similar variances to Ag Surf School and Nantucket Surf School. So looking at his application, it is emergency medical facility, site location, water and sewage, shelter for day camps, sewage disposal, toilet facilities, hand washing, more toilet for special needs, hand wash basins. This, in my opinion, is a different scenario. We're out at Pocomo Point, which is a private beach. It's not lifeguarded. There's no porta potties. And when I went through that presentation, the requirements can't be met because it's on private property. So as long as we keep doing this, it's going to be the same thing. Now we could go and say the primitive route. This would be the only primitive camp on Nantucket. But when I went into the code and I read all the definitions and I looked at all primitive camps in the state of Massachusetts, all of them have a base of operation with all basic needs. This camp does not. So that's why we have the stock recommendations that we do. And yeah, so that's what I have to say about that so far.
What would it take to have a permanent location somewhere?
So we've tried, basically our challenge, we're different from the surf schools where there's been an established protocol of they're renting at, there are town slots to rent at Cisco and there's a town slot to rent at Novadear. We came to Nantucket, knew not knowing the rules at all, and there was a town reg saying you have to have a permit to operate on Nantucket coaching kiteboarding. So there was no opportunity to set up a concession on the water or anything. So we went before the Board of Selectmen and got approval for that. So our permit, it's a weird thing, but we're permitted to operate on the waters of Nantucket Harbor. We have tried everything we can to comply and do things the right way. So we rent a slip from the town at the town pier, just like all of the charter fishing operations, everything. So that's our access point. Technically, we have bathrooms there. When we're teaching, we're on boats. We're teaching kiteboarding, wakeboarding. So unlike surfing, which is a shore-bound activity, we're a little bit different in that we're a boat-bound activity. So for us, it's like we're trying in every way possible from day one to just adhere to the rules. Like that's first thing we did was go before the town and get approval. We've sought legitimate access through getting a slip downtown. And when we're here with you guys, it's the same as working with the Board of Health. Like we're just trying to follow every rule and run the safest protocol we possibly can. And given that we're on boats and how we access, it kind of puts us in the tricky situation we're in.
But you do have a permanent spot at the town. So is that considered a permanent spot?
Yes.
Is that considered a permanent spot?
Yeah, so I mean, we tried to have this discussion when we met where it was, why isn't your base of operation 24 Washington Street, and we can work from that. But I think that I wasn't a part of that discussion when it happened prior, and then we're going back 2 years, of like why that couldn't happen, but that would be closer than we are now. I don't know if that's possible because of traffic control, the bathrooms being public, but like, I don't know. I didn't look into it because what we're working on is that one area. And that's where I go to inspect, but.
Yeah, but to me, simple guy. If they have a permanent spot, then they can consider themselves a. What kind of camp?
Primitive camp.
But they do have a permanent spot. Can that area have all the things that they need?
I don't believe so.
The place at the town pier, you mean?
Yeah. I think that was proposed. I might, this was before my time of being a health inspector, but I believe that was proposed a few years ago and there was reasons why it couldn't. But I mean, I don't know if that's the direction.
But that's where like, we're happy to do, we proposed that previously and we were denied, said no because of traffic plan. Like ultimately the hole for us that Heather brought up is the bathroom situation. And not having access to bathrooms. And so that's where like.
And emergency medical.
Well, and emergency
shelter.
medical
Yeah.
facilities. So if it's a matter of a tent, we have a tent. My employees would love if we put an awning on the boat and we could label it like, it doesn't say a tent or medical facility has to be on land. It just mentions
The
a tent.
infirmary boat.
We can make an infirmary boat.
Yeah.
I think it's pretty specific. Hold on.
I would be happy with it.
I know.
It just says a labeled tent with proper shade and a policy that shows that any ill camper must be called for.
That's my language.
Oh,
That's not the code. That's like when I met with the state, that's what we came up with to try to make it more feasible for more people to be able to do it. But I mean, yeah,
at the end of the day, the test is, can we provide a safe alternative for kids to run, to operate? And we have a 10-year track record, impeccable track record. We love what we do. Like, we're out here teaching kids how to boat and have fun on the water, just like the surf schools are teaching are teaching surfing, just like NCS is teaching sailing. Like, we're not out here with malicious intent. We've followed every rule to the T and we're doing the best we can, given that we operate on vessels, teaching something that it's not a traditional camp, but it's something that makes Nantucket cool.
So if they're permanent places at the town pier, there are bathrooms there, yes?
yes, they're right.
Yes.
Yeah, they're bathrooms.
Women's, men's, their hand wash stations.
Okay.
Everything's there.
So if
Okay.
was the issue a lease?
No, the
Or-
issue is the traffic plan of being able to pick up, drop off there because
Why
it's so
can't you-
crowded.
Why can't you do that? You have boats.
We could, absolutely.
I think it's
That's
more
fine.
parent drop off.
The parent brings
But
the
I,
kid.
Parents find it annoying because there's so much traffic
Well,
there. I
the
would
parents,
That's too
yeah,
bad.
I
You know
don't
what?
really know.
That's too bad.
to
But the
me,
town parking lot's
to
right
me-
there, right?
there's no reason the parents can't be a little inconvenienced. It might be that or not having your camp.
Absolutely, and if, I
So
mean,
that would mean I would need to inspect at 24 Washington. So before we go down this route, we have to make sure that it's feasible that I can
no,
inspect.
it's
right
not,
there,
it's not 24 Washington, it's at
20
Town Pier.
Which
So
is
if we
whatever.
can
address.
pull up all the vessels and,
Well, you know what I would suggest, before we all get crazy and tired,
Right.
yeah,
why don't you two go down to his permanent location and see what's there? And if parents will just have to drop their kids off there and pick them up there, yes?
I think that's better than the Bacamo Point on somebody's backyard
Yes, is
situation.
to me, that seems like a
Yeah.
reasonable thing to do.
Yeah.
And
We're-
there's
we're
a
happy.
town parking lot right across the street.
Yeah, I
Yeah.
mean, come on.
I'm happy to
I used
do
have kids.
whatever you guys.
I spent my life dropping my kids off in strange places. so.
Well, now, what about the hospital? I mean, not the hospital, the tent thing. Can that boat work for that, Heather? Can we make
That would, I mean, that's your
Because if we
call more than
solve
my call.
problem number one, we still have problem number two.
Yeah, I mean, like I said, that's when I met with the
state to make sure that what I'm writing in my presentation is allowable. I didn't mention boat tent.
We'll work out the boat tank. okay?
So that's on you. Yeah,
Let's work out the boat tank.
Yeah.
So
So what are we doing? Next month,
we're going to make a motion to extend this item to next month.
Okay.
Okay.
And we're gonna
Yeah.
go, we're gonna inspect his permanent location. Okay, we'll just delay it for a month.
And the boat tent design.
We're gonna be creative about a boat tent.
No, but I'm saying, but that, you know, when they come
No,
back.
we have to, I don't wanna put it off another month.
No.
No, 100%. And one thing I do ask is I live off island, and I have a small infant and everything. So I'm wondering if I could
You can
attend,
do it Zoom.
if I could attend via Zoom, it would be.
Yeah.
It's fine.
Well,
I can attend Zoom.
No.
Thank you very much.
Thank you.
No, I'm getting, I have to go. I have to go, so I'm
We
like,
need to take a vote to extend it or no?
we can just extend.
Okay.
It's not a public hearing.
Perfect.
It's a public hearing, we would have to take a vote.
Great.
Great.
And you're in charge.
Guys, long night for you, huh?
Yeah.
We're pretty close. You're not going, Jim. Don't go anywhere. He can leave.
I'm leaving.
We're not.
Time is up.
I'll be
We're,
quick. It's-
we're almost, there are a
it's
couple
6:30,
things
I'll
that
be
I
quick.
think need to come up. So I wanna,
Again, there's
I
questions.
have a couple of things
Let's,
that I
like,
would
meet
like to,
again.
not long discussion. I just
Okay.
wanna bring them up for,
Okay.
Want to do a Teams meeting?
so you tell me when to do that.
Is it
It'd be,
for me or is it for?
It's for all of us to think about and
o'clock.
decide
So
when
do
we
you
want
want to
to
do that
address.
without, Harry's here, so, yeah, okay.
We have a forum still.
You want me
Yeah,
to
let's
stay with
bring
you?
it again.
Okay, so
Before you.
there are three.
You
One
just
is
get on the page that we're
Sanctity,
doing.
the Sanctity Caddy Camp that we agonized at
Yeah.
great length
Yeah,
over.
we'll do the same thing.
Well over a year ago, and we put them to this fall to present to us what they were doing to rectify their situation, and we've heard from all these other nice people, but we certainly haven't heard a peep from them. And there's some, sort of rumor that they're doing some kind of construction, but we haven't heard anything about that, so I'd
So
like
Heather can
to.
give you an update on that, Sanctity.
Oh, yeah, so, they're gonna be done by sorry, I missed the first half of what you said, just because there's so much going on, but, they're gonna be completely done by summer, and they're meeting all of the requirements for Sanctity. What was the first part of your question?
Well,
Sorry, missed that.
we had, well, I mean, I can't tell you how much, how long we spent on this.
Yeah.
And we went back and forth and et cetera. And I'm just very surprised that they haven't come to us and said, this is our plan, this is what we're doing, and this is how we're going to meet the needs that you have requested. It's a little bit
So that might,
surprising to me.
yeah, that might be maybe the way that I've explained it to them. So everyone that's coming, it's because they need variances. They're at the point where they don't need any variances. So they don't feel like they need to explain it, I think. And that might be me like saying like, oh, you don't need to come with your variances. So if that's something that
It
you're,
was sort of left hanging in my mind.
Okay, yeah, I hear ya.
Because we really, I mean, this was probably one of the biggest angsts that
Yeah.
we've been through.
I
And I think that we need to have a resolution on that.
100%. So I've been in contact with all of these camps for the past few months. I don't believe that Dave would have any issue coming in here and explaining or
Just
giving
have
an
somebody
update.
come and say,
Yeah.
this is what we're doing, this is how we're gonna meet the whatever.
Yeah,
Done.
cool.
Okay.
I'll send him an email.
Okay, so, yeah,
Perfect.
perfect. The second thing that I wanted to just bring up for everybody's thinking, and it came up earlier when we were talking about PFAS. And we've talked about it so much, but you know, in all the years that I've been doing sort of clinical stuff, I have found that an awful lot of people don't understand risks. They don't understand what we're talking about. They don't understand why this is a problem. They don't understand what is wrong with having PFAS in your water and in your everything. And I thought that we had talked about having a bit of an education program island-wide about what this is, why it's not good for you, what the options are to test for it, to to rectify it and all that, and I wondered if we have any plans for doing that. We need a public service.
No, to answer
Okay.
your question, I have not.
Okay.
Discussed that with anyone. However, as I mentioned earlier, we do have our environmental contamination administrator starting in January. And I
Okay.
could certainly,
Maybe that could
education
be-
is gonna be part of his job. He is extremely well versed in this area. He's got a lot of experience with working with PFAS with lots of different organizations, so he will and this is something that we talked to him about specifically, is really educating the public. So how best to do that? You know, I'm sure we can come up with a plan on
Or maybe he'll
what
even
that
know.
looks like.
Yeah,
We make sure that when he starts, he gets in touch with the PFAS action group to
Yeah.
get.
Yes.
I'm gonna, so this person, I was just gonna be actually one of my
Oh.
director's update, so
Okay.
let's kill two birds with one stone.
okay,
So he will, he lives like in the Boston area, so he will be on island 1 week per month for meetings and, just the logistics of getting to know the island. But he can still meet with people in person during that time, or he can do it via Zoom, whatever will work out. But yes, we intend to, I mean, we've already started speaking to him about all the different players and what has occurred. And you found some of the legacy information that's available of what has occurred over the years, so that he can hit the ground running. And so, yeah, we'll be introducing him to all the people interested in this topic.
that's great, because I think if we can put that fairly high on his agenda of things to do, we can get the citizens educated in what we spend so much time talking about, but many people really don't know.
Yes.
Yeah,
You know, the only thing I wanna say is not to shoot down anything you've said, but I think if someone I knew had PFAS in the well, I think you're doing, if you don't say anything, you're doing a disservice to those people. I think you should tell those people and tell those people to talk to the people next door and the people in back of them, and the people in front of them. I would try to make everybody aware, everybody. You know, when I sell a house to someone, I have to do that to the well to have a PFAS test, you know, and if it comes back and it shows that, I tell the people, tell your neighbors.
well, that's a little bit of a different issue. That's going back to what we were talking about.
Yeah, I know, but
before.
I mean, like he
About-
says, he's restricted.
Well,
that's a
what
different
I was
thing.
focused on was, are we gonna just put this stuff online for
Yeah,
for consumption in that way? And
Right.
we had serious privacy concerns around doing something like that.
Right.
But communicating with people that are in at-risk areas is something that's important as far as, and what I mentioned earlier was that I need to understand how we can do that in a way, whether that means getting consent from the
Right.
people who,
Yep.
can we let your neighbors know that you had a high
Right.
PFAS rate, or do you want to tell your neighbors, whatever the case may be, there are ways to go about it that is
Right.
not violating somebody's personal privacy.
Right. Last but not least, and this is sort of a thorny one, I think. I was at something the other night. And people came up to me, knowing that I'm on the Board of Health, and said, why are you guys in charge of the short-term rentals? And I
Yeah.
couldn't answer the question.
And
I realize that it is something that we all need to talk about and then take it further and try to figure it out.
I'll tell you exactly why we're in charge of them. Okay, a lot of people don't want to hear this, because the Board of Selectmen sucked us into a meeting. And they said, we're gonna meet with the Board of Health, select person, right? And what they did is they didn't wanna have anything to do with it, so they gave it to us. So they could say, when someone went to them and said, you know, what's going on with this? You know what they'd say? Hey, don't talk to us, it was the Board of Health who put it through. And I know that for a fact, and that's exactly, I've said at this meeting, or 3 or 4 meetings, we should have nothing to do with this, we should stay so far away from this. And, you know, they were asking us about, put us in charge of parking places in front of a house. I said to one of the Board of Selectmen, I said, What do you, that's got nothing to do with us, nothing to do with the Board of Health.
And I'll just say that I don't know the answer to that question. I mean, Jim.
It's
has had
nice
some
to know the
experience.
history,
Yeah,
Jim,
but
but that doesn't mean we
but-
have to keep going with
yeah,
that.
and I don't know what the reason was. I mean, I've heard different theories as to, that's being done that way on Martha's Vineyards, for instance. I've heard that one. I've heard, there's not that many boards that have enforcement authority. There's few. And so you have enforcement authority. So, there's not a town department that's PFAS, that's short-term rental.
Same idea.
So there's not a great place to put this, period. And that's, I think, what I've heard in the short time that I've been here. And I don't disagree with anything that you said, I'm just trying to run the registration system. I think we have, it's going now where it is functioning much better than it was. The enforcement is going to be tricky, because I anticipate having a new person that will fill the role of kind of monitoring the registration system and also enforcing or going out to, clear complaints. But, I don't have the staff to
That's the whole thing.
go out there and check compliance on all these short-term rentals. The only thing we can respond to, but we'll respond to it anyway, is if there's a complaint. We will go out regardless of whether it's a short-term rental or not. And so, I think, I could only say that, right now it's in our court, and we are doing the best we can to do this registration system, which is really what we're tasked with right now. And the enforcement thing, we're not even thinking about that right now because we don't have the staff for it. But that's coming, and we're gonna have to figure out how to do this. And so, that's, that's my.
I'm not asking for us to figure this out. I'm asking for us to find a time and a way to, as a board, to talk about what we think we should be doing in relation to this. And then, once we've done that, figure out who we can talk to get relief, so to speak, if we think that's the right course of action.
Okay.
So I just wanna bring it up so that we can get it on an agenda, so that it's something that I honestly don't know what the meeting laws are about how we can. Does it need to be a public discussion? Does it need to be can we talk about it among ourselves with both staff and board?
Executive session.
If they're going to do that, I think it'd have to be an
Executives.
agenda item as part of the board of health meeting.
Anytime you're deliberating or talking about something with forum, it needs to be a public meeting that's posted with an agenda item to discuss that. So yes, it would be at a meeting.
It could be a special meeting, it could be, at a time when we don't have as many agenda items as we had today. But I think, I agree with John. This would have to be an agenda item because it is an open meeting.
Is there a way that we can speak about it ourselves first? And then have it be an open, at an open meeting?
Yeah, that'd be serial communication is a violation of the open meeting law.
Right. You can't meet with just separately to discuss a topic it's going to then go before. I mean, that's a violation.
Jericho raised his hand.
Oh, go ahead, Jericho.
Hello, sorry. There are provisions under open meeting law for executive session. There is a best practices section of open meeting law GLC 30A21 that has 10 reasons permissible for entering executive session.
Maybe you can share that with me, Jericho, and I will share it with the board without discussion.
Understood.
Perfect. Great, done.
All right.
Thanks, Jericho.
Okay, so just a few topics. So today, there was a software system called Circlebot AI that was listening in on our conversation. It's designed to help us capture minutes. So we're kind of we are piloting for the town different software products that we might be able to use to help us capture minutes more. Because it takes us hours sometimes to go through and write everything out and think about. You have to really listen to the recordings again. So the idea is to really streamline that process and make it easy, not only for us, but if we can find a product that works really well, we can share it with the other towns. So there's minutes being taken all over the town with all the commissions and meeting groups that we have. So that was that's going to be happening monthly. So if it's not this particular software next month, it'll be something else. But I will keep you posted. Let's see, we had 10 people take the Surf Safe training the first week of November. Only 7 took the test, but all 7 passed. And so thank you for John and team to, I think Jake was the one that was providing that education for that course. So every person we can train additionally is good for the community. And then finally, thank you for Heather. She's done a wonderful job working with the camps. We think that we may not have another camp variance actual request, and I think we had more than double last year, and just because of her individual work with these camps to help them meet the requirements, you're going to see fewer of them this
She
time.
did a fantastic.
Yeah, she did.
Thank you.
Really good.
Thanks, guys.
And there is a new reporting requirement to the state regarding camps that we've recently found out about. So moving forward, the health department must report information on each camp, including the variances that were approved by the Board of Health. But that's something we take care of internally, but just for your awareness that that has to happen and it's happening. That's all I have.
That's not really new, they just developed a new portal.
Yes, I'm sorry, it's a new portal, it's a new system to capture the information.
Yeah, that's good.
That's all I have.
No health problems, no,
Not to discuss, there's always health problems.
well, you know what I mean, no public health problems.
No?
No, well, actually, I take that back. We did have a couple of chicken pox cases.
Oh, yeah.
That were identified on island, 2 separate facilities here in town, with children. Both of those children received treatment. They were sent home and isolated with their families. They do not appear to be related. We have not been able to make a connection that they actually came in contact with each other, potentially spread it. And we put something out, I think it's probably going to go out, it went out today for the media, kind of a media blast, just kind of reminding people that there's a vaccine for this. If you're not vaccinated or your child's not vaccinated, symptoms to look for, when to call your healthcare provider. So that actually went out via a blast.
If there are children that were near those children that are unvaccinated, the state has laws about how long the unvaccinated or under-vaccinated children need to be isolated home.
Yes,
Which
we have been in contact with the state epidemiologist,
Yeah.
so
Super
they've been
interesting.
getting the guidance on how long that child needs to stay home to look for, and for other children that are in the house. So all that has been communicated. So we've been working with those families.
Super interesting.
Yeah. Again, super contagious disease. Fortunately, there's a vaccine for it, and the majority of the people are vaccinated. But every once in a while, you have cases occur.
It's required for school.
Yeah, that fall between the cracks, and when it could be daycare, and they may not have that yet.
They get it at 1 and 4.
Yes, so, I won't give any details, but one of those person that fell outside the range of.
One was under 1, I know that,
Yeah.
yes, yeah. Yeah.
Maybe PFAS exposure makes you not be immune. I'm not saying that's related to this. I'm kidding. But it does make you not have the same immunity to vaccines. Not related to that.
Yeah.
But
Okay, that's all I have. Now I'm
Okay,
back.
great.
Rocky?
Yes,
Yeah,
sir.
just, I'm gonna, and this is asking for your ongoing guidance for this. In light of the potential changing public health environment, I just ask to try to help us, keep focused and, just what might be changing and how we can address it on the island. It's a little bit scary, a little bit right now, some of the initial reports, but it seems like there might be some changes that we know what to deal with. So, would appreciate your
Yeah.
guidance on that.
I assume you're talking about H5N1 and that type of thing?
I think I'm talking about
Talking
how to, I think I'm talking more, in terms of the CDC and that stuff,
Yeah.
Oh,
so.
okay. As far as the type of guidance that's coming down.
Yes.
Yeah,
I think
okay,
that's
I
what
got
he's
you.
talking
I
about.
understand.
And, in some cases, how we can stay the course if we feel something is important and, what the implications are, because that can impact budgets and stuff like that, because going above and beyond federally funded projects, if the funding goes away, makes it harder to do. So your guidance during this period of change is going to be greatly appreciated.
Sure.
Okay.
Motion to
Wait,
adjourn?
yeah, motion to adjourn.
I made a
Meredith?
motion.
Okay, Carrie,
Adjourn.
Meredith?
Yes.
Ann? Okay, done.
Thank you.
Very
Are you guys gonna meet back at Fourth Fairgrounds?
Yes,
I mean, this is crazy out here.
January. I think there was just it started in January. So
What was the problem?
I think there was just a competing,
But there's no parking at
I know,
fairgrounds, or we,
there's no parking here either.
like,
So-
for how long is there gonna be? no
Oh, yeah,
parking
that's
at
right. Fairgrounds is,
Oh, it's, yeah, so I don't know. But our scheduling, it was a scheduling issue, is why we couldn't go there. And so, I asked for that room starting in January, because that's